Okay, and if Katie will take the roll, please. Oh, okay. Whenever you're ready. Uh-oh.
Good morning, Mr. Chairman. This is roll call for joint ag for July 28th, 2026. Senator Crago.
Here.
Senator Love.
Here.
Senator McEwen.
Here.
Senator Pearson.
Here.
Representative Davis.
Here.
Representative Fornstrom.
Here.
Representative Johnson.
Here.
Representative Ottman. Representative Provenza.
Here.
Representative Schmid.
Here.
Representative Strzok.
Here.
Representative Winter.
Here.
Co-Chairman Ide.
Here.
Chairman Banks.
Here.
We have a quorum.
Thank you. So we'll dive right in here. The first item for our consideration this morning is livestock pregnancy examinations. And we'll turn the time over to LSO to present the material that they came up with. So Clayton and Anna, appreciate your work. Yes. Pardon?
You'll need to approve the minutes
Oh.
from the last meeting.
Thank you. Do I have a motion to approve the minutes from last meeting? Moved by Senator Taft, second by Representative Provenza. All in favor, please say aye. Opposed, no. Okay, thank you. Any more housekeeping items, Katie, before we get going? Okay, perfect. Go ahead, Clayton.
Good morning, Mr. Chairman, members of the committee. Clayton Caldwell, a research analyst with LSO. I have provided for the committee a research memo that explores states that allow non-veterinarians to preg check livestock if they meet certain qualifications. And I found 5 states that do this. There's Arkansas, Colorado, New Mexico, Oklahoma, and Utah. And today I'll briefly explore those and then I'll stand for any questions. So getting started, Arkansas allows certified technicians to perform livestock pregnancy determinations, and they have a lot of kind of specific requirements to get certified, and I'll mention a few right now. First, there's their educational requirements, which is to either have a master's or doctorate degree in animal reproductive physiology, or to complete a course that is provided by someone who has similar educational qualifications. Certification also requires a licensed veterinarian to provide a letter that affirms the applicant's ability to preg check with at least a 90% accuracy. And then finally, Arkansas is kind of unique in that Arkansas requires applicants to have at least a 50% financial interest in livestock management equipment like embryo freezers or ultrasounds. Now, moving on, Colorado's statute allows veterinarians to delegate a variety of tasks to veterinary technicians or vet techs with at least indirect supervision. And performing reproductive ultrasounds is one of those tasks that they can do. Now, to get certified as a vet tech in Colorado, there's really 2 pathways for this. There's certification by exam and certification by experience. And for the first one, vet techs need to complete or graduate from a school that's accredited by the American Veterinary Medical Association and then pass the vet tech national exam. But alternatively, vet techs that have a provisional vet tech registration in Colorado can submit proof of 6,500 hours of work experience performing vet tech duties and proof that they've passed that national exam, or simply submit 9,000 hours of work experience. But note that experience-based pathway does expire in the end of 2027. Moving on to New Mexico, their administrative code describes bovine pregnancy diagnosis technicians as those certified by the board to perform bovine pregnancy determinations. Now, to get a permit for that, applicants must pass a course that's approved by the Board of Veterinary Medicine. And in that course, applicants need to palpate at least 50 cows, and they also need to preg check with at least a 90% accuracy. Then moving on to Oklahoma, they're kind of unique because Oklahoma allows anyone to preg check farm animals, but only by using transrectal palpation. But Oklahoma also allows reproductive services technicians who are certified by the board to perform non-surgical embryo transfers and basic ultrasonography. And in order to get that certification, they need to complete a written exam and either have a PhD in animal reproductive physiology or a master's degree, and then also board certification from the American Registry of Professional Animal Scientists. Now, finally, we have Utah, which permits anyone to perform bovine pregnancy testing if they have a master's degree or higher in animal reproductive physiology. But they also have an ongoing education requirement where they have to perform at least 8 hours of ongoing education within the past 2 years. That's a brief summary of the contents of the memo. I can stand for any questions.
Thank you, Clayton. Appreciate your work on that. Committee questions? Yeah, go ahead, Senator.
Thank you, Mr. Chairman. Thank you, Mr. Caldwell. On that, you referenced that 50% financial interest in livestock equipment. How do you police that? I mean, what do they do? Do they have to give a financial statement and show that they contributed, and if it's depreciated? I mean, it seems like kind of an odd thing to have. I think that was in the Colorado law. Is that what it is?
That's Arkansas.
Or that's Arkansas, you're right. Yeah.
Yeah, Mr. Chairman, members of the committee. So I really just limited myself to what the literal legal requirements are. And this is found at the very last paragraph of that section. That's on page 3. The statute, it just says they have to have a 50% financial interest in that kind of equipment. As for how exactly they would police that, I can't say.
Okay, thank you. Yeah.
And Mr. Chairman, from my reading of it, I kind of loosely based this bill off of Arkansas. But from what I could tell, they only had to prove that when they were first applying to get that certification. So I don't necessarily know that it's like an ongoing thing that they have to keep proving year after year or what have you.
Okay, thank you.
And Mr. Chairman, just to
Go ahead.
build on that, that would be correct, because these are just the requirements to become certified. It's not an ongoing.
I see.
Further questions? Clayton, thank you. Anna?
Thank you, Mr. Chairman, members of the committee. My name is Anna Johnson. I'm a staff attorney for LSO. And I drafted 27 LSO 0076 bovine pregnancy determinations by non-veterinarians at the request of the committee at the last meeting. There's a staff comment right at the beginning of page 1 that indicates that the bill draft only includes a certification process for non-veterinarians to perform bovine pregnancy determinations on cattle. So the committee may wish to consider including sheep or some other type of livestock within the draft. And then beginning on page 2, the bill draft would create requirements for a person who is not a veterinarian to be certified by the Board of Veterinary Medicine to perform bovine pregnancy determinations. A person applying for that certification would fill out a board-approved application and then pay a fee. And the applicant would also have to provide proof that they'd reached age 18 and that they have no criminal convictions related to animal cruelty, animal neglect, anything involving the practice of bovine pregnancy determinations, or disciplinary or other regulatory actions prohibiting the applicant from performing bovine pregnancy determinations. They would also have to get a sworn statement from a licensed Wyoming veterinarian who has witnessed the applicant's ability to accurately and safely perform bovine pregnancy determinations. That includes a description of the applicant's ability to do this, the dates that the veterinarian witnessed the determinations, and if ultrasound equipment was used, that the applicant was able to perform the determinations with 90% accuracy. And then you have a staff comment on page 4 indicating that the committee may wish to consider requiring applicants to be knowledgeable in the use of ultrasound equipment rather than making its use optional. An applicant must also successfully complete a course approved or developed by the board and taught by a licensed veterinarian on bovine pregnancy determinations. Then there's a second staff comment that begins on page 4, indicating that the committee may wish to consider requiring applicants to have a financial interest in ultrasound equipment and other livestock management equipment as needed for a bovine pregnancy determination practice. And then the board would be required to approve or deny a certification within 30 days after receiving a completed application. And a certification shall expire every 2 years and must be renewed through a renewal application and an established fee. The renewal application must include a record of completion of 5 hours of continuing education related to bovine pregnancy determinations. And the board has to approve it or deny the renewal not more than 30 days after receiving a completed renewal application. And the board can also establish a grace period for certification renewal of not more than 60 days past the certification's expiration and establish a late fee. The draft also indicates that any person who practices bovine pregnancy determinations without a veterinary license or unexpired certification under the section will be in violation of the Veterinary Practice Act, which would be, I believe, a misdemeanor. And the amendments on page 6 through 8 are conforming amendments. And then section 3 on page 8 requires the Board of Veterinary Medicine to promulgate rules, and section 4 provides a split effective date. And I'd be happy to answer any questions.
Thank you, Anna. Appreciate that work on that. Any questions for Anna, committee? Representative Ottman?
Thank you, Mr. Chairman. Anna, I recall that there was something in the writings that said that any licensed veterinarian that helps someone to do this could be in trouble. There was somewhere I read that. And so while they're in the process of getting certified, do you recall? I've been reading so much, I can't really tell you where it was.
Mr. Chairman, Representative Ottman, I don't remember that specifically. If there was a certification process that was enacted in Wyoming, they would be allowed to, non-veterinarians would be allowed to preg check cattle with a licensed veterinarian watching them do so until they got certified. Does that answer your question, or were you thinking of something else?
No, it doesn't. Maybe I was not clear. I'll just wait to see if it comes up and see if I can find that paragraph. Okay, thank you. Clayton, Mr. Chairman?
Go ahead.
Clayton, did you happen to recall what I'm referencing?
Mr. Chairman, Representative Ottman, there are several provisions in some states that I think relate to what you're talking about. So for example, and this isn't quite mentioned in my memo, but Utah does have several provisions that I think specifically relate to that. So there are some provisions for if someone is training to complete that kind of pregnancy checking certification, or otherwise like they're going to school to become a veterinarian, that a licensed veterinarian that's simply helping them train would not be liable for any kind of misdemeanor. It would still comport with their Veterinary Practice Act. But in a lot of states, that's still generally the case because it's education and it's training. And so that kind of hands-on experience is generally considered in compliance with the Veterinary Practice Act. Does that answer your question?
Okay. Chairman Ide.
Thank you, Mr. Chairman. Yeah, on page 3, line 7, a sworn statement from a licensed Wyoming veterinarian. What happens if you can't get a sworn statement from a licensed veterinarian? And the second part of that question is, this still looks like you need permission and a certification from the state to do a preg test. Essentially, just want to confirm that. And how do we make that a little more liberal to where you don't have to have a certification? I mean, is there states that allow pregnancy testing without a certification, or did you find anything like that in research? Thank you.
Thank you, Chairman Ide. So basically, there are many amendments you could make to this bill if you wanted to take some of this out. The sworn statement is just something that I saw that I saw other states doing, and I kind of based it off of that. However, I mean, it's a committee's prerogative whether or not you want to amend things out or add things or whatever you want to do. As far as I can tell, I don't think that any states just allow non-veterinarians without a certification or any kind of qualifications or like discernible qualifications. I don't think that there's any states that allow people to just go out and do it. I mean, Clayton can correct me if I'm wrong, but I'm pretty sure that the states that allow it require some sort of certification or educational process.
Yep, Mr. Chairman, members of the committee, just to build on that, the letter requirement that Mr. Chairman, you had asked about. So there's Arkansas that requires this, and then there's New Mexico as well. Just receiving that testament from a licensed veterinarian is just considered part of that credentialing process. Now, most of the states that I discussed today do have some kind of actual credentialing requirements. So either receiving a credential or a permit from a state board to practice and perform pregnancy testing. Utah is an example of a state that has an educational requirement, but not necessarily a certification. Their state statutes just say that anyone can perform pregnancy testing on bovines so long as they have a master's or a doctorate in animal reproductive physiology.
Follow up?
Yeah. Yeah, thank you, Mr. Chairman. Yeah, quick follow-up. Yeah, that Utah, it seems like that would be more, other than you still have to have, a master's or a degree in some sort. I think that's onerous too, to be honest with you, from my vantage point. That's sort of the point of this, is to allow this pregnancy testing without a whole lot of permission from the state or a university degree. And I guess that's my point. Thank you.
And I think if I heard you right, Oklahoma is the least stringent. And I think that's more the direction we wanted to go. And so my question is, did I hear you correctly? Was Oklahoma the one that was just kind of allowed the transrectal palpations?
Mr. Chairman, members of the committee, that is correct. Oklahoma is fairly unique in that they explicitly allow anyone to perform pregnancy tests on farm animals, but only using transrectal palpation. And that would just be on page 5. I did speak with the executive director of the Oklahoma State Board of Medical Examiners, and they had iterated that it's only that specific method and a good test that they use to determine whether or not a pregnancy test is legal is if any kind of equipment or analytical tools are used. So the moment someone pulls out an ultrasound machine, then it becomes illegal unless they are either this reproductive services technician or they're a licensed veterinarian. I also would like to mention Appendix A. This is just a table of all of the preg checking laws across all states, as opposed to the qualification-based permissions.
Further questions for our two attorneys here? Representative Davis?
Thank you, Mr. Chairman. Does Wyoming accept from the border communities or from the border states such as Utah and Colorado? Do we recognize their practices in this? Is it like a reciprocal agreement across the state border? I guess is my question, being on a border community, that's my question.
Go ahead.
Mr. Chairman, Representative Davis, do you mean veterinarians or these certifications?
Mr. Chairman, the certification, do we recognize that practice across Wyoming state border?
Mr. Chairman, Representative Davis, I don't believe so. I'm pretty sure we don't.
Representative Provenza.
Thank you, Mr. Chairman. Remind me, last year, we were looking at vet tech, and I think it looks like the veterinarian, like technical credential process exists in the other states, and the other states rely on that sort of process. So they have veterinarians and they have vet techs. And if I remember correctly, this committee denied that pathway. And so my question, I guess, is like, is it difficult to kind of tie our statutes to this, given that we don't have some of the other credentialing mechanisms that would allow for a checks and balance?
Go ahead.
Mr. Chairman, Representative Provenza. So like you said, we don't have licensed vet techs in Wyoming. We do have, I believe, what is it, like fertility specialists for cattle and things like that. So I based it kind of loosely off of things like that within the Veterinary Practice Act. But yeah, as far as veterinarians and vet techs go, we don't really have a process as far as credentialing people that are under these veterinarians or working with them or working either alongside them or independent of them. We don't really have a process for that at this point.
Further questions for two attorneys? Senator Love.
So as I listen to all the conversation here, it seems to me that we're actually putting a lot more restriction than what the state currently has on preg testing. We're creating a licensing or participation opportunity that is above and beyond current. And so does our current law delineate between W-2 and 1099 employees of a ranch to be able to do this? Does it?
Go ahead.
Mr. Chairman, Senator Love. So there is an exemption in the Veterinary Practice Act that allows people that are working with a rancher or a farmer to allow that rancher or farmer to let lay people work with their animals, preg check, things like that. There is, I believe that it allows for preg checking as long as you're working with the animal's owner. But go ahead.
So just to follow up on that thought process, then if any person participating with that farmer ranch that is considered an employee of some nature, because I don't see in our law anywhere where it delineates the difference between a W-2
No.
and a 1099 contract employee. And so anybody currently can do this under the guise of a 1099, which is currently required in most transactions over $600 for about anything. And so I'm just trying to make sure I understand that what we're doing is actually putting more stringent requirements on our current scenario versus what we already have.
Mr. Chairman, Senator Love, so the exemption is just for people that work directly with the rancher or the farmer, work under him. This would allow lay people who have a certification. It would allow a farmer or rancher to hire them to come in and do preg checking.
So that's my question for you. As a 1099 employee of Farm and Ranch, and a lot of us do this in the industry, if we have a 1099, we report the 1099 on that individual and they're operating as a contract employee of the ranch, they can currently do this without any licensing.
Mr. Chairman, Senator Love, I believe that's true. I believe that exception does cover them. I'm sure there's veterinarians in the room who could correct me if I'm missing the. Yeah.
And so with a simple subcontractor agreement, which we sign every day in business, you could, the person wanting to hold themselves out to do this for that farm and ranch for that intended purpose can sign that subcontractor agreement, which would be reported on a 1099. And they could legally do this without any licensing process.
Mr. Chairman, Senator Love, I haven't looked into this in particular. I believe that's probably so, but I'm sure there's people from the Board of Veterinary Medicine who are sitting in the audience who could correct me if I'm totally off on this.
I would just like to really understand that,
Mhm.
Mr. Chairman, just so, because if we're growing the process, I don't know that that's what Wyoming really wants to do.
Okay.
If we can do this with just making some clarification of what's required to be considered an employee or a contract laborer for that farm and ranch and still do this without this process, maybe that's where we would prefer to be. Thank you, Mr. Chairman.
Thank you. Further discussion, committee? Questions? Yeah, go ahead. Chairman.
Yeah, thank you, Mr. Chairman. Yeah, I like the point that Senator Love brought up. Actually, Chairman and I kind of had a little sidebar here, and we kind of discussed that last time. I don't know if anybody remembers specifically what we talked about, but the W-2 versus the 1099 contract labor. If that's the case, if you have that freedom, then you could contract with as many ranchers as you wanted to on a 1099, just contract labor. And is the law fuzzy there? What would your comment be on that right now? Thank you, Anna.
Go ahead,
Thank you,
Anna.
Mr. Chairman. So I think it would be helpful to clarify that within the statutes. It probably wouldn't take a whole lot of work, just a clarification under that exemption, or maybe a different statute, like a creation of a new statute or something, just to make that clear, just so that there's no gray area. So.
Thank you. Representative Johnson, I see you have your hand up there.
Yeah, thank you, Chairman. I think this is just for the information of the rancher. There's no legal binding to be qualified or certified or do additional instructional classes. Cows are impregnated, right? So I don't see why we or even
Representative Johnson,
it's
we're
a-
having a trouble hearing you.
Wow.
Maybe turn your video off so that we can really hear strongly the audio. I don't think he can hear us
no.
either.
I would say it's just better. I would say purely for the information of the rancher. And what the rancher wants to do on his ranch is his business. If that tech is certified or not, it doesn't, he just wants to know if his, so I think we're not here. It happened without any issue.
Thank you, Representative Johnson. So we kind of are having a trouble hearing your audio. Maybe if you turn off your video, it'll help your audio come through stronger.
It is off.
No, that
Yeah.
still didn't work, but we'll do. I think we got the gist of it, but thank you. Oh, now we lost him completely. Okay, committee, further questions for our attorneys? Senator Love?
Mr. Chairman, through you. So maybe we're better off to just clarify amend the current statute so that it allows for both W-2 and 1099 labor. And then we have the clarification moving forward for if anybody were ever to question in court, and it just simplifies this whole process.
Mr. Chairman, Senator Love, I could just make a amendment to that exception, if that's the direction of the committee, for sure.
Mr. Chairman, thank you.
Yep. Senator Pearson?
My thing isn't working. Thank you, Mr. Chairman. So a question for you. Was there any research done as far as insurance that has to be held? Because if we're not going to do certification under a licensed vet that knows what is going on here, and are these people going to have to hold insurance? Should there be injury to the animal? Should there be misdiagnosis, things like that? So thank you.
Mr. Chairman, Senator Pearson, so I don't think there were any insurance requirements in the statutes that Mr. Caldwell and I looked at. However, we do have some insurance agents in the room who would hopefully be able to answer that question. But as far as I know, in the actual practice acts and the certifications and whatnot in other states, I didn't see anything regarding insurance. I don't know if Clayton did, but I didn't.
Mr. Chairman, Senator Pearson, yeah, in any of the states that I looked at, I didn't see any kind of specific insurance requirements. The closest that I saw to that is just simply the fact that some of the states will allow any kinds of pregnancy testing methods, but others will specify which kinds of pregnancy testing methods are permitted. For example, in Colorado, vet techs are permitted to perform reproductive ultrasounds. And then conversely, in Oklahoma, they're permitted to perform, anyone can perform only transrectal palpation. So depending on the state, they may simply limit which kinds of pregnancy tests are permissible.
Thank you.
Thank you, Mr. Chairman. Yeah, just a follow up on what you just said there. I mean, it seems to me that the operator should be the one responsible for making sure whoever's doing their preg testing to verify the insurance and not, make it a mandate. That's their job. It's not the state's job to protect them from that. Thank you.
Senator McEwen. Oh. Representative Fortstrom.
Thank you, Mr. Chairman. All I would like to add is under Senator Love's suggestion, wouldn't the operator, I mean, at that point, you're working for the operator. The insurance is a non-issue in any way. So, I mean, I think that kind of resolves itself under that scenario.
Go ahead, Senator McEwen.
I tend to agree with everybody on the W-2 1099s, but I think we need to clarify that also. Because as I hire 1099 contractors, sometimes, depending on the scenario, they're required to have insurance and other times they're not. So I think we need to just put in there, in this case, the owner operator is responsible for insuring the herd and anything that happens to it. Thank you, Mr. Chairman.
Thank you. Representative Davis.
Thank you, Mr. Chairman. Maybe not, Dan. What's the current liability insurance for veterinarian practices as we currently have in the state?
Mr. Chairman, Representative Davis, I am not entirely sure, but I believe that we have the Board of Veterinary Medicine in the room. So they'd be able to answer that question for you. I'm not sure what the thresholds are on that.
This might be a good segue to our next agenda item, which is to go over and discuss the insurance portion if everybody's ready to move on to that portion of it. Okay, thank you. Appreciate all that information, your time. Believe we do have a Mr. York here to discuss some insurance with us. Oh. Come on up, sir. Time is yours.
Am I green? I'm green. Yep. Mr. Chairman, I don't really have, I was asked to come and maybe possibly answer some questions.
Perfect.
I do, just listening to the discussion, I agree with a lot of what's
Mr. Chairman,
said.
can we get a name and introduction, please, just for the record?
Oh, sure. My name is Daniel York. What kind of introduction would you like? I'm sorry, I'm very.
Yep.
I'm here with Tegler and Associates. We are an independent agent here in Wyoming. So we do agricultural insurance for sure. I've heard professional, we do quite a bit of that as well. So yeah, I don't have a lot of a dog in this fight, certainly. I agree with some of the even there, if someone hires someone to come and do the work, they should probably decide whether or not they want to have them insured or not. And that's most of the contracts that we're fulfilling. The insurance requirements for are coming down from the owner of the property, the owner of the project, the general contractor, maybe the operator, as you put it. So I'm happy to try to answer any questions you might have.
Thank you. Appreciate you being here to do that for us. Questions for Mr. York? Go ahead, Senator Love.
Mr. Chairman, thank you. So as I think through the insurance process and the comments that have been made, I don't know that we want to I don't know whether we want to demand producers to have more insurance, but under a current 1099 contractor scenario where you require insurance, a basic liability policy would cover any of this activity as a farm and ranch 1099 employee, correct?
Yes, sir. Mr. Chairman, Senator Love, I agree that I don't think it should be required. That's something that they would have to do. But I do want to clarify, I suppose, and make sure I understand the question correctly. If the ranch or farm owner has a liability policy, that is not going to respond if they bring in someone to do some work for them. That would have to, that would have to be, that person would have liability. So maybe a clarification on
Mr. Chairman.
Go ahead, follow up.
Yeah, so just to help clarify that thought process, then I'm not thinking about, so I'm thinking we shouldn't add more insurance responsibility to the producer. They can choose to self-insure their cow herd if they want. They can choose any of those options. When they bring this lay person in to do this work for them as a laborer and a 1099 contract employee, those employees oftentimes just have a basic liability policy that they work under. So that liability, just a general liability policy, would cover that individual going on to that farm and ranch. There wouldn't need to be a new insurance subsection created to cover this, right?
And
Go
if
ahead.
I can make sure I'm understanding the question, I'm sorry, I'm probably a little slow here, but you are saying specifically if this person coming onto the ranch has their own coverage?
Mm-hmm.
Yeah. They could absolutely have their own coverage and get that. The only thing I think that I would clarify on that is that, you said, getting off in the weeds here a little bit, you said a basic general liability policy. Basic general liability always has exclusions and or limitations for any professional liability or errors and omissions. So they would, the preg checker might have a general liability policy, and there could, if he didn't purchase professional liability on that, there could certainly be exclusions for anything beyond general liability, which is simple bodily injury and property damage. Giving, certainly medical advice or something could be excluded if he didn't purchase that in addition to a general liability policy. Does that answer the question?
Good. Further questions on insurance? Yep, go ahead, Senator.
Maybe. So as I understand this, in the 1099 process, you're hiring a contractor. And I don't understand maybe the nuances between a ranch and, let's say, a grocery store. If I hire a contractor to do landscaping or work on the building or the refrigeration, and I 1099 them, they're required to have insurance. So would this be any different if we're 1099 preg checkers? Thank you, Mr. Chairman.
Yep, go ahead.
Yes, sir, Mr. Chairman. And then Senator McCune, I agree that you're correct. I would just be careful with the word required. I would say they would have, in most scenarios, a 1099 contractor, unless there's some sort of other contractual requirement, when you're talking about statute or some other, municipality, they are probably not really required to get insurance. But if they were going to, they would have to choose to do that. And then there are very few statutory requirements, maybe if any, for a 1099 person to get a liability policy. And so at that point, then it would fall on I believe we're saying the operator here, the owner, to verify that, is, hey, if you're going to come out here, you have to give me sign this contract saying that that's a requirement, or give me a certificate of liability.
Quick follow-up.
Go ahead.
So if the 1099 employee comes out, does the preg check, hurts the cow or gets hurt or something, and he doesn't have insurance, he's still liable,
Absolutely.
right?
Absolutely.
Thank
Yeah.
you.
Representative Hornstrom.
Thank you, Mr. Chairman. I just, frankly, I don't understand maybe quite right the difference between, I mean, how would this differ? And I think this is where we're trying to get to. And frankly, I think we're already there, but if you hire someone for day labor on your ranch and they run a herd of cattle off a cliff, how would that be any different than this scenario? I mean, I think they're the same employee at that point. They're not doing anything extraordinary by preg checking your herd versus herding them off a cliff potentially. So, my opinion, I guess.
Go ahead.
I agree with what you said, but I think not requiring more insurance is necessary. But I think there needs to be language in there, if we're doing a preg check bill, that a 1099 employee can be covered under the owner operator's insurance. I don't know if that's possible, but.
Go ahead. You respond?
Yes, sir. I mean, respectfully, I don't think you can probably, if there was some sort of statute that came down and said, we would, the state of Wyoming would require 1099 to be covered for, some sort of medical or services that they were to provide. I mean, that's just not in the form. These forms are pretty well established. A ton of lawyers look through them, and ISO, and I'm sure the Department of Insurance would have a opinion on that certainly also. But in fact, there really is a distinction on policies between a W-2 employee and a 1099. So a W-2, if they're acting and working for the operator, then their liability is covered. Like you said, if they are doing preg check or whatever, there's no liability there. They're just, if they hurt that animal, that's part of the risk you have there of doing that. But then a 1099, I don't think you're going to be able to require the operator to cover their insurance necessarily. They would have to get that if that was required of them or they chose to do so. And one other thing I was going to say specifically, many insurance policies will actually specifically exclude, there can be a couple different levels on this, exclude 1099 labor altogether in a more punitive situation, or it will not respond only in excess over the 1099's policy. So they would have to have their own insurance be primary, and the operator's policy could exclude that totally if they didn't have their own primary coverage, the 1099.
Senator Craigle.
Thank you, Mr. Chairman. So most 1099 folks that come to, for example, my ranch aren't going to have liability insurance. And I think that's true for most people that are doing that kind of work around Wyoming. And mostly because it's not available. I mean, I don't think that's a kind of policy you're going to go down to your local insurance agent and ask to get, because they don't have that type of coverage. That's not a policy that they most likely have. I mean, you can get a general liability type policy, but I highly doubt that's going to apply if someone comes to your place and hurts one of your animals. You take that risk on as the owner and the operator, that they're going to do something to your livestock, and it's your job to manage that. I don't think that's possible. And number two, we're talking about a professional practice at this point. This is very different than just everyday type day labor activities. And so now we're saying we're going to give these people the ability to come and do what up until this point has been veterinary medicine, a professional practice regulated by the state. And now we're going to say, you have to go get liability insurance for that. Also probably not going to happen because it's not, at this point, we're not really going to regulate it. I mean, if we adopt the bill we're talking about, but it doesn't sound like we're going that route, we're just going to say you can go do it. Then you're just back to a regular 1099 worker. And so I think we're just kind of going down a rabbit hole that's not going to have an end when we're talking about insurance. I think we're better to focus on what are we talking about? What are we going to let people do or not do? And if you want to hire a non-veterinarian to come check your cattle, the risk is on you, not them. You know that when you hire them, that they may not have the certifications required to actually do the job. That's on you as the owner, not on them. And so I guess I'd rather us focus on something else, Mr. Chairman, than worry about insurance, because I think we could talk about that all day long. And then also, just from a legal point of view, the word employee typically does not include 1099 workers. And so if you go to the exception that's listed in 333203, that allows an owner to do whatever they want with their own livestock. I mean, it specifically uses the word employee. And I think to the good senator's remarks earlier, if we want to include 1099 type folks, that's going to be the easiest route to go mess with that. If you don't want a certification, if you want to just say anybody can come check your livestock, that would be the easiest way to do that, is just go in there and change the language in there. I'm not a proponent of that, but I think that would be where you could do it. Thank you, Mr. Chairman.
Appreciate that. I think with that, we'll move on from the insurance portion. Thank you. Appreciate you being here. And where we're kind of not going the route of this bill draft, I think we'll still just let the agenda play out and have Dr. Hazel come up next.
Good morning, Committee Chairman Banks. Good morning, and thank you for the opportunity to speak with you this morning. First, I want to make very clear, as was just emphasized by Senator Craigo, that pregnancy examination of bovine is a medical diagnosis. I want to make that very clear. That being said, this draft bill does a couple things that basically inhibits the Wyoming Livestock Board from performing one of its essential missions, and that is the surveillance, the control, and the eradication of animal health diseases. Veterinarians are our primary source of surveillance and control and eradication of animal health diseases. Being on the farm is where they collect this information. This bill directly negatively impacts the ability for us to be able to do that. And number two, our ability to recruit veterinarians in this state with a bill that does not support them in any way whatsoever is seriously impacted. With that, I have no further comments. Thank you.
Questions for Dr. Hazel? Go ahead.
Thank you, Mr. Chairman. I'm just curious in your role, as the law currently exists, how many cases or how many complaints do you currently hear, understand, look at for non-veterinary practices like this? I mean, how many times does it come up in an average year?
Go ahead.
Representative Banks, Representative Hornstrom. That question I would defer mostly to the Board of Veterinary Medicine, because they're the ones that actually accept those complaints. And I know that they are available online and come up next, I believe, for comment. I do serve on the Board of Veterinary Medicine as an ex officio member. So that being said, we do receive those complaints. They occur every year. Usually it's because of the same people. So we know what's happening. Is it a huge income source for some of those people? Probably not, but it does occasionally happen. But that being said, I would ask that you present that question to the Board of Veterinary Medicine.
Senator Love, did you have one? Oh, Senator Pearson.
Thank you, Mr. Chairman. I guess I have to form this in a question. So besides the possibility of losing our large animal veterinarians, the opportunity for diseases to be spread across this nation, maybe you could talk to us a little bit about the availability of being able to get antibiotics from a veterinarian and how that could possibly impact ranchers that are using this layperson to prick check their cattle. And then also, I don't know if you know this, but what percentage in large animal practices across the state, what percentage of income is preg checking in their practice? Thank you.
Go ahead.
Chairman Banks and Senator Pearson, I'll try to remember all the parts of your question. Forgive me if I don't. First of all, when you're talking about obtaining antibiotics, prescription antibiotics specifically for a herd, that veterinarian must have a veterinary client-patient relationship with that owner, manager, producer, whatever it might be. For that relationship to occur, that veterinarian has to be on the premises. They have to understand the management of that herd. They have to understand the production of that herd. What are their goals? What health issues do they have? For them to be able to prescribe the correct antibiotics legally. Once that relationship is established, it's typically renewed kind of on an annual basis, or it's just maintained for as long as that client works under that veterinarian. But that relationship has to be legally in place before any antibiotics can be prescribed, and for that producer to be allowed to purchase those antibiotics from a different location other than a veterinarian. That is a legal relationship that must be in place. A veterinarian establishes that relationship when they're on that premises, when they're doing their herd work. During the time in the fall, when we're doing herd work for pregnancy examination, we see every animal that's out there. We understand what's going on with the management, what has changed in the last year. Why are these cows open? Is there a nutritional issue? Is there a health concern? What's new? What's different? All that is established, and the biggest chunk of that occurs during that pregnancy examination. Extremely important. As far as the percentage of income that is derived from pregnancy examination, it is highly significant because that clinic rides on fall for kind of the rest of the year. And I would also make note that I know that the Board of Veterinary Medicine is up to speak next. And Dr. Ben Osborne, I believe, is online, and he would like to address that very topic with regards to the percentage of income that they receive from fall pregnancy examination. Did I miss anything? Okay, thank you.
Senator Ide.
Yeah, thank you, Mr. Chairman. Dr. Hazlett, thanks for being here today. You made a couple of comments, control and surveillance. You said them a couple of times. I don't think we're trying to, I always get nervous when I hear control and surveillance from the state, federal government, state government. You know, what we're working at here is just a little more liberty for people to preg test without permission from the state. That's all we're trying to accomplish here. Thank you.
Chairman Banks, Senator Ide, I totally appreciate your effort. What we're trying to do, though, is when we say talk about control, we're talking about controlling disease spread and surveillance for disease. And those are primary things that we accomplish by having veterinarians on site, just to make that clear. Thank you.
Representative Ottman.
Thank you, Mr. Chairman. Dr. Hallie, one of the things I've been looking up ultrasound incentives and looking at different documentation. And one of the things is that things grow and things progress and times change. And so we know as lawyers and doctors and legislators, as time goes on, we all learn different things and how to do things differently, hopefully for the better. And a lot of times things change, like these sonograms for preg checking. That is something that was not available or wasn't commonly used. We see other states now are doing it, so it's out there. One of the things that I've heard a lot about, and of course would be a topic that you would bring out, but it also, there's no incentives for this sonograms, but producers can benefit financially and operationally. And I'll just read off a couple of the things because I think it'll come up later. Beyond pregnancy checks, ultrasound can detect ovarian cysts, uterine infections, and other reproductive issues early, improving fertility and reducing open days. It can also assess body condition by measuring fat and muscle thickness. So there is that observation, and these people are trained. It's not like a 2-hour class. I mean, they would be certified, and the producers have that option of whether or not they would seek to hire someone. And as was brought out last time, things are already going on because veterinarians are not always, this is a time-sensitive time in our state, and they're not always available for the smaller producers. So what I'm thinking is that this is not to replace their relationship with their veterinarian, who would want to do that. But it is also like if I have my regular doctor, but I want to go talk to the pharmacist because of something a little different, I can just go to the pharmacy. I don't have to go right to my doctor. That does not negate the relationship with my primary care physician. So I just wanted to add that is that while we are looking at this, this is to be in addition to the agricultural benefit of herd management in the state, not to take away from anyone. And it's up to the producers to hire, to determine who works with their cattle or not. So I just wanted to make that comment, Mr. Chairman.
Thank you. You have a response, Dr. Hazel? Okay. Representative Davis?
Thank you, Mr. Chairman. The good senator next to you said he was concerned with control areas, but I believe Wyoming does have control areas for brucellosis. Could you expand a little bit on how your relationship with them veterinarians in that area and how the cooperation works there?
Chairman Banks, Representative Davis, thank you for that comment. We do have the designated surveillance area, which is approximately 6 counties in western Wyoming. That is the brucellosis surveillance area. And it's in conjunction with the whole Yellowstone region, so also Idaho and Montana. Within the brucellosis designated surveillance area, all the cattle that are 12 months of age and over, sexually intact, that leave that area, when they either change ownership or when they leave those counties, they must be tested for brucellosis. That testing is done only by veterinarians. It is done as an annual herd, when the annual herd exams occur, those cattle are tested for brucellosis. And that is a way of surveillance for brucellosis, also knowing and catching it within the herd whenever there might be just maybe one impacted, not the entire herd. And those veterinarians collect those samples. They're reimbursed by the state of Wyoming to collect those samples. And all the testing is done at the Wyoming State Veterinary Diagnostic Lab. And that brucellosis surveillance occurs because we have brucellosis within the greater Yellowstone region, being Teton and Yellowstone National Parks. The primary source of, or basically of contact for brucellosis right now is within our elk population as the elk commingle within our livestock herds. All of the veterinarians within the DSA work with us very, very closely. We have personal relationships with those veterinarians. The minute a producer sees an abortion in their herd, they can instantly call us or their veterinarian to have that animal checked for brucellosis to make sure that that abortion isn't due to brucellosis. And at the same time, we look for other diseases that might have occurred within that herd. But the big chunk of that surveillance testing is done with those veterinarians that we know during pregnancy examination, because that is when the veterinarian determines what is the open rate of those cattle. What's the significance of that open rate? Has it increased since last year? Are they not breeding back? And all of that is done with that fall herd work and with that relationship that we have with those veterinarians. They call us frequently. We have a very good, strong personal relationship with them. Thank you.
Thank you. Go ahead, Senator.
Thank you, Mr. Chairman. So one more question. I know I'm kind of hammering you today. So my question would be, what is the likelihood if we have somebody, not a veterinarian, coming in and preg checking? What is the likelihood that, say there's 30% opens in that herd, that the rancher is going to contact the veterinarian and say, we may have a problem here? Because my feeling is that many ranchers in this state who run in common with other ranchers, if they have 30% opens, they're going to get rid of those cattle ASAP and aren't maybe going to report that to a veterinarian. I really struggle with this because I know ranchers that do that. If they have a high percentage of opens or opens in general, they are immediately getting rid of those animals. And, you know, possibly there won't be that reporting. And where are those animals going? And what are they going to do to other flocks across the state? And so that's what I'm curious to know, is if there is a high percentage of opens and there's not a veterinarian present, what is your feeling on that? Thank you.
Go ahead, Doctor.
Thank you. Chairman Banks and Senator Pearson. With that being said, if there's a 30% open rate, number one, how did they figure that out if they don't have a veterinarian on site? That's my first question. I think that's an assumption that they're doing the pregnancy examination on their own. I'm not sure. But first of all, how do they determine that 30% open rate if they don't have a veterinarian on site? Second of all, if they have a 30% open rate, they're not working with a veterinarian to figure out what's going on. They would have already been in contact with that veterinarian to say, hey, my cows aren't calving on time. The calves may have something abnormal. What's going on with my herd? A herd with a 30% open rate is extremely serious. And that is a large enough financial impact that could put you out of business, especially in today's society. So I would make an assumption on my part, and I'm using the word assume, we all know what that means, but that herd owner is also not working with a veterinarian and doesn't have that relationship already intact to be able to determine the cause of that open rate. But that being said, too, typically if a producer does have a large open rate, they are not working with a veterinarian. They will either keep those cows to recycle back, which is a huge financial burden, or they will take them to their livestock market, or they will take them directly to sale. There are rules at our livestock markets that require certain testing of bulls to be able to go back out into the country. One of that is trichomoniasis, for them to be able to go back in the country. So those bulls that go to a livestock market that don't have a trichomoniasis test cannot legally be sold back to the country to prevent that disease from spreading. If they're going direct to slaughter, there isn't any further diagnostics done, but we do remove that source of whatever the disease might be. Thank you.
Other questions for Dr. Hazel? Thank you. Appreciate the information you provided. Okay, we're going to move on to the Board of Veterinary Medicine. And did they send somebody in the room or were they all online? Oh. Online? Okay.
Mr. Chairman, we have Kylie Dorr and also Dr. Osborne.
Okay. Go ahead.
Yeah. Can you guys hear me?
Yep, go ahead.
All right, perfect. So I apologize that I'm not attending in person today. As with the last meeting, I was not able to be there in person. And hopefully my internet connection doesn't fail me. Right now we're at the Uintah County Fair for the annual Osborne family vacation, showing our stairs at the Uintah County Fair. So I apologize that I'm not there in person, but I'm happy to answer any of the questions that you guys have, both from a board member perspective as well as a private practitioner perspective. I practice here in Uintah County, Sweetwater County, and Lincoln County primarily. We do a little bit of work up in Sublette County as well. Work within the DSA area, and a large percentage of our income, as the two practices that I own, come from our fall preg check work. I did provide a couple of letters, and hopefully you guys have those in your packets, a couple of letters of opposition of the draft legislation, that kind of outline one, more from a board perspective, I guess. And then the second one kind of outlining a little bit from the perspective of a private practitioner in the state, as well as kind of hopefully a little bit of kind of the macroeconomics of, Wyoming being a cattle export state, with regards to our ability to export our cattle to other states, in opposition of the draft legislation that's being proposed today. So anyway, I guess, looking at the draft bill, and I know that the conversation has turned a little bit from the draft legislation itself. Obviously the Wyoming Veterinary Medical Board is in opposition, both from a standpoint of being able to, govern and look at these lay palpators. I know that the legislation does give us the ability to do so, but is also a little bit burdensome on the board, to be overseeing lay palpators from the perspective of, how do we regulate these individuals? What are the checks and balances that are there? And then, from the standpoint of a private practitioner, it does open up the chance of liability for those veterinarians who are certifying these individuals. There is some liability placed on those veterinarians, particularly in signing the affidavit and ensuring that they can do what they can. When I went through veterinary school, it's interesting, some of the legislature at other states require them to palpate 50 head. And I do find that a little bit laughable. When I went through veterinary school, they said to be proficient at preg checking cows, you need a minimum of 1,000 head to even start to understand exactly what you're doing. And so I think, I think there's a little bit of misunderstanding with regards to the level of certification that is required to be proficient and efficient, and also from the standpoint of animal health and husbandry, to make sure that you're doing it correctly so that there's no potential injury to the livestock with which you're examining. So.
Thank you. Appreciate that. And I'll say this too, I appreciate the written statements you sent, especially when we're in something like this on a time crunch and can't get the full testimony. The letter is appreciated and being in respect of our time. So I just wanted to say that. Any questions for Dr. Osborne? Yes, Representative Provenza.
Thank you, Mr. Chairman. Dr. Osborne, say that I decide next year that if we pass this law, we remove the government from the process at all. There's no requirement for certification. And I'm like, you know what? I could go grift on this. And I go to a bunch of ranchers and I say that I can do a preg check for 50% off from what they're paying you. And I can get through a season before maybe people find out that I'm a fraud. How much money can I make?
Yeah, I mean thank you, Mr. Chairman, committee. I mean, that depends. Obviously, the market would bear whatever it would bear. And each individual veterinarian determines exactly the fee schedule for their own services. I speak from personal experience because we do have a couple of lay palpators who are currently working under the exemptions that are in the Practice Act to begin with. They are not practicing outside the bounds of the Practice Act. Those particular individuals in my practice area are usually charging about $1 a head. As far as how many cattle they're actually preg checking, obviously I can't attest to that. I have a little bit of an idea, from year to year based upon our own preg check records. So if they're charging $1 a head, they could potentially, within our practice itself, we preg check, somewhere between 30 and 40,000 head each fall. Obviously they're not going to acquire all of that business. But if they were ambitious enough, they could, stand to potentially bring in, between $20,000 and $30,000. Do we as a practice charge $1 a head? No, we do not. That would not be financially feasible within our operation. There are 5 veterinarians, 2 practices. Each preg check that we attend, each pregnancy diagnosis and herd check that we perform, we take 1 to 2 veterinary assistants with us. Those veterinary assistants bring with them digital record keeping. So we take a ruggedized tablet. We record both the animal's ranch identification plus their individual identification, whether it be RFID or metal tag. We're recording the status of that pregnancy, whether it's open. We stage that pregnancy within 15 to 30-day intervals for that producer, record body condition score on each individual animal, as well as age if we can do so, like if the tag number indicates the age of the animal. And part of that is in response to lay palpators trying to add a value-added service so that we can compete with those lay palpators. And then once we are done, we consult on the records that we receive on the overall conception body condition score, provide pivot tables, and each individual rancher gets individual preg check records on all of their herd and individual animals within that herd. So it's a significant portion of our annual revenue and helps to sustain us so that we can provide other regulatory services, emergency services, similar to what I outlined in the opposition statements that I sent to you guys.
Thank you. Go ahead, Representative Ottman.
Thank you, Mr. Chairman and Dr. Osborne. One of the things that I'm wondering about and thinking about is that in order to hire someone, it would be kind of like for a producer to just hire some fly-by-night that drives up in a pickup. The machines, these sonogram machines, are very expensive. And the training that goes along with that is expensive. And there would be certification on that type of training. I don't know in Wyoming here that our agricultural community is so vague that people wouldn't ask if someone had a reputation or if they were known. One of the good things about this as well is that an ultrasound can confirm pregnancy as early as 28 days post-breeding compared to 45 with the rectal palpitation. The other thing is the equipment is smooth and things, and a vet doesn't have to be as close. So the equipment really is easier on the animals. Once again, with Dr. Osborne, you can see, I appreciate you saying how many head that could be, because it seems as though there's some people that breed, we did it so that we would calve in the middle of the winter, and I wondered why, but it was to move the cattle. There's usually certain seasons, and so therefore there is a need at certain times more than others. And so this again, the whole gist of this opportunity that we're contemplating is to enhance our agricultural community, not to diminish anyone or anything in it. So that's just what I had to say. Thank you.
Further questions for Dr. Osborne? Thank you. Appreciate your testimony for us today. Miss Orr,
You're
you
welcome.
have
You're
anything to add?
Thank you, Mr. Chairman, members of the committee, Kylie Dorr, the Executive Director for the Wyoming Board of Veterinary Medicine. And I am just here if you guys have any specific questions to numbers regarding licensure or anything specific to the board. Otherwise, I don't have anything else to add.
Thank you. I appreciate you being there to offer that. Any questions? It's like you get off easy. Thank you. Appreciate you being willing.
Thank you.
Okay, we'll open it up to public testimony. Anybody in the room wish to testify in regards to this topic? So hit the mic there till it turns green and with the button there. There you go.
Cameron Treby, retired ranch hand. I live here in Casper. If the legislation that the committee is looking at, and if that legislation that you're looking at is refined or changed, I would like to ask if you would consider an automatic certification for all the students that take the 16-week artificial insemination and pregnancy testing class at the University of Wyoming at Laramie and get a good grade from their instructor, could be offered a automatic certification without a veterinarian becoming involved in it. I took that class. I can't remember what my grade was. I mean, it's quite a while back. But there was no automatic certification offered to me. And thus, I did not do any of my synchronization work here in the state of Wyoming. I simply moved over to South Dakota, North Dakota, Montana, Texas, and spent the rest of my life synchronizing cows. And I also took the class just not because I was required to take it, but simply because I was interested in the information offered. And I had a relationship with the instructor at Sheridan College. That's a 5 credit class, whereas Laramie was a 4-credit class. Also a 16-week intensive course, artificial insemination and pregnancy testing. And I would just like to ask the committee to consider in the future, if the legislation stays as it is, and you're simply refining it and making it better, to offer those students in the future that take those 2 classes. The Laramie class is offered every spring. The Sheridan College class is offered every fall. And it would inspire those departments of animal science to have more students come into those 2 classes. It would create greater interest in your University of Wyoming Animal Science Department in Laramie. Would create greater interest in the students at Sheridan College to take these 2 classes if there's an automatic certification for a good grade at the end. Thank you for your consideration.
Thank you, Mr. Treby. Appreciate your testimony. Questions for Mr. Treby before we let him go? Okay. Anybody else come up, fill the chairs? We'll go with ladies first.
Thank you, Mr. Chairman, members of the committee. Karen Clark with the Wyoming Farm Bureau Federation, and I proudly represent nearly 3,100 farmers and ranchers across the state of Wyoming who are members of our organization, and an additional 8,000 members that support agriculture here in Wyoming. Our members support individual freedom and the opportunity to choose. We've had some great conversations here, and we've continued to have those conversations with our members. And when I think about our ranchers, I think about those hardworking people across the state of Wyoming who steward the land, steward their animals, care for their animals. And there's been a lot of conversation about herd management and disease management. And in all the conversations that we've had with our members, and especially in this last month since the Joint Ag Committee met, to make sure and talk about, like, what are the conversations you're having with your veterinarians? What are the conversations around this topic? All of the conversations we've heard is how important that partnership is with their veterinarian, and how important it is also for the rancher to manage their herd and have the individual freedom and let the free market drive that. Wyoming Farm Bureau Federation would support the way the conversation is going here in clarifying the current statute and not having more regulation for lay people to be able to pregnancy check cattle. And so would support that clarification. It would provide clarity in the statute for being able to pay lay people for pregnancy checking. The free market's going to drive that for sure. There's some certification processes that LSO reviewed, many other states do. In our conversations with some of our members that utilize neighbors to preg check, they are going through that certification process. And if they're not doing their job, they're definitely not going to come back. And the other question that I've asked some of our ranchers is, okay, when you are having your conversations with your veterinarian, are you having any trouble getting them to come out and help with herd management if they are not the ones preg checking? And the ranchers that I've talked to, they've maintained that relationship. They've made sure and had that relationship with their veterinarians, regardless of who is doing the preg checking on their ranch and managing that herd. One example from one of our members is location is critical as well. And so you have people we know Wyoming, sometimes it is hard to get to places. And so the timing is critical, and we know how important it is to schedule out and schedule early with the veterinarians to make sure they're on the list for pregnancy checking. And also the ability, though, for those ranchers who are out in far locations and can't necessarily get the location they need and the time they need. We've had members that have expressed the importance of being able to hire out lay people to do their pregnancy checking. And so it's sitting here in support of the direction the committee is heading in clarifying current statute, and would be happy to take any questions. Thank you, Mr. Chairman.
Thank you. Appreciate your testimony. Any questions for Farm Bureau? Go ahead, Senator Craigle.
Thank you, Mr. Chairman. Thanks for being here today. So I guess in all of those discussions with the members and the membership, I mean, are there any other places in the veterinary practice statutes that you think we need to create more exemptions? Or are we just talking about only preg check? Because we're creating a carve out, right? As of today, it is veterinary medicine. So are there other places where the membership thinks it would be okay to cut vets out of the loop, so to speak? Thank you, Mr. Chairman.
Go ahead.
Mr. Chairman, Senator Craigle, thank you for that question. That has not come up in conversation with the membership. Our policy is very specific, and our members have asked for the ability to pay anyone they choose to pregnancy check their livestock.
Go ahead.
Follow up, Mr. Chairman. So one of my concerns with the idea is, and we heard from Dr. Osborne a little bit ago, this is a significant portion of all the vets I know and deal with. This is probably what puts them over over the top, allows them to make a profit. In the fall of the year, they're busy for 2 straight months preg checking everybody's livestock. And if someone else is doing that work and they're not able to make a living, what's that going to do to the amount of vets that are in the state? And how are we going to recruit people to come here to be vets? Because we already have a problem with that. And are we making that worse? And was that a discussion point with the membership? Because it's all great and dandy. I mean, to be able to save money on the preg checks, I would be all for that myself. But at the end of the day, when I need to haul a 2-year-old heifer in and get a C-section and there's no vet left in KC, Wyoming, what am I going to do? So what was the discussion along that? What did the membership say in those terms and in those regards? Thank you, Mr. Chairman.
Good.
Thank you, Mr. Chairman. Senator Crago, thank you for that question too. It's absolutely an important question, and having rural veterinarians, large animal veterinarians here in the state of Wyoming is so very important for ranching, for animals, for Wyoming. So definitely a discussion point. The members, the conversations that we've had, I've asked them to talk to their vets. Like, please, like, talk to your vets. What does this look like? So in some areas of the state, they have relationships with their veterinarians where they have that conversation like, hey, I've been asked to come and preg check this rancher's herd. How does that work in you? And one area says, that's great. The relationship they have with a veterinarian says, we cannot get to every animal in this county, in this area. Then you do have areas, I mean, I've had a veterinarian call me and say, can you change your policy? Well, no, not in the Farm Bureau. We don't change our policy. Our members do change our policy. And so his question was, why can't you change your policy? And Wyoming Farm Bureau Federation has been advocating since 1920 for what our members say. So what's in that policy book is what we'll advocate for. That's the only phone call I've had from a veterinarian. The questions that I've had our members ask the veterinarians, it does come up. Herd health, access to veterinarian, rural veterinarians. How are we going to get veterinarians back in the state of Wyoming? That's an important topic as well. And so the conversations, Mr. Chairman and Senator Crago, the conversations talk about both, the importance of it, recognizing also that ranchers have the bills to pay too, because we've heard the argument like, well, we have bills to pay. Everyone has bills to pay for sure. What is in the best interest of the animal management of that ranch? Now, many of the members we've talked to, they're going to continue using their veterinarian. If there's clarity in the statute, that the direction that we would support that you're going, if there's clarity that says you can pay lay people, there's going to be people that choose that. And there's going to be people that continue to utilize the large animal veterinarians that they already have relationships with.
Representative Provenza.
Thank you, Mr. Chairman. I guess follow up to that. It sounds like the conversation that you had with members was go talk to your veterinarian and ask them. But my question would be, is your membership going to vote the same if your question to them was, would you be willing to potentially lose your vet for lower preg check prices? Because I think that's the reality that we're dealing with. You might lose your local vet. Is that worth the less amount of money that you're going to spend on preg checking?
Go ahead.
Mr. Chairman, Representative Provenza, thank you for the question. Yeah, so when I want to make sure and clarify, when I ask them to talk to their vets and them talk to us, like this conversation, we've had this conversation for years. So this policy has been on our books for a lot of years. The conversation in this last month, I asked them to increase it. Like, let's clarify and see what is happening in all of the regions. The information that I've heard from the members that we've talked to in the different areas, Mr. Chairman and Representative Provenza, they recognize that having the impact to large animal vets, they also recognize the impact to their ranch and their ability to manage their herd and what that looks like. And so I use the example of a rancher that's in a location that might be a little bit harder to get to, and the vet might not be able to get to there, depending on their management. Every rancher manages their herd differently. And so some are going to be preg checking a certain portion when they're up in this section, some here, and then some when they come in the fall. So.
Follow up.
Yeah, I guess explicitly was when you ask the question to your members, do you present the possibility that they won't have a vet anymore?
Mr. Chairman, Representative Provenza, thank you for clarifying. Yes, that question comes up. Like, what does it look like if we do not have large animal vets in our communities? I don't know that there's an answer for that. That's a conversation, though, that is in all of the communities.
Representative Davis.
Thank you, Mr. Chairman. You touched on one thing there. The layperson there, is there any conversation about what type of qualification there would be to justify that as a layperson as opposed to the veterinarian? Any conversation educational wise or?
Go ahead.
Thank you, Mr. Chairman. Representative Davis. On the conversation about what kind of certification or what kind of training that they've gone through, absolutely. So there's a lot of different, my understanding, and I'm not familiar with the certification programs. I know they were reviewed quite a bit there by LSO. The member that I talked to very specifically about the certification, because I asked, like, how many hours, how much time, what have you spent? For that person, there was a 2-day certification clinic, and I believe it was south. I can't remember if it was Colorado or Kansas. So I can't say specifically on that one. And then he talked about just the time in doing it in the herd management, that as a rancher, he himself, the time that he has spent palpating cattle and then learning the ultrasound certification.
Senator Ide.
Yeah, thank you, Mr. Chairman. I'll be brief. Thank you, Ms. Clark. I like your comments, especially on the free markets. Let the operator, the producer decide whether they're qualified or not. I mean, they've been in the business a long time. I don't think, centralized government can decide who's best for the rancher to preg test their cows. That's on them. My question is, as expensive as it is to get a veterinarian degree, and in particular, large animal, I think that, there's a shortage of them. And then you start hearing talk about the state subsidizing their education, which is the wrong path to go down. What do you see out there in the field on new veterinarians coming online? And is that going to be a problem here directly? Thank you.
Go ahead.
Mr. Chairman, Senator Ide, definitely it is already a problem, and the legislature addressed it this last session, with looking at, you mentioned it, the education and trying to have that, having the education for getting vets back to Wyoming. I don't know that I can speak very specifically to statistics for having large animal vets, and it is an incredible, important topic that we come in. I want to be clear, we support veterinarians. We very much support veterinarians. They are working partners for farmers and ranchers in their businesses. We also support, again, the individual freedom for the rancher to manage their herd.
Thank you. Other questions? Thank you. Appreciate you being here and your testimony.
Thank you.
Sir, you're next.
My name is Travis Clyde. I'm a rancher from the Sweetwater Valley. Maybe a little clarification. When my daughter started this, the whole thing is not to take away from the veterinarians. It's
You pull the mic just a little bit closer. Thank you.
it's to allow people to hang their shingle out and say, hey, I'm available to do this. With some sort of certification. We're not advocating for no certification. That's foolish. And the working with your veterinarian, you can't get away from it. We have to. We can have somebody come preg our cows, but who's going to come bangs our heifers? Who's going to trick test our bulls? Who's going to, C-section a cow at 2 a.m? Our vet won't, but you won't lose that relationship with your veterinarian. You have to have it. The concept that this will eliminate the veterinarians because you're undercutting them. You cannot charge significantly less money for this. If you're going to do it right, there's going to be fly-by-nights that are starving to death that they're going to do this and charge $1 to do it. You're going to starve charging $1. Sorry. There's a minimum that has to be charged. It's what the vets charge. And it allows some flexibility, like what said, we have places we can be at certain times. We only have facilities in certain places. There's a lot of that out there. When you're coming through, you need a vet. You got a window of a week. You need somebody there or somebody to test cows because you're moving on. And that was the kind of the idea was, all right, this is legal. I'm available to do this. This isn't somebody this is my career. That wasn't the concept. It's so you don't get in trouble for doing something. Yeah, we can go to work for somebody and we can work under them and get paid. That's fine. But you can't hang your shingle out. Hey, I went through the trouble of getting certified. I went through the trouble of buying an ultrasound machine and the expense and learning how to use it properly. And even having a working relationship with the veterinarian, that I don't have the answers to this. As a layperson preg testing, I don't have the answers, but talk to your vet, or this is the veterinarian that we work with. This was the ideas that were all involved in this process up to going forward. Thank you.
Thank you. Appreciate your testimony. Questions? Committee? Representative Davis?
Thank you, Mr. Chairman. So if I understand you, what you were kind of saying, so you want to work in cooperation as like in these areas where we're having difficulty getting to the herds, that you would be, say, a subcontractor to a veterinarian? You would be the person that would work with the vet to cover these areas, or did I miss something in what you're stating there?
That's a possibility. I've talked to veterinarians that they would be maybe more willing to go along with this if they had somebody that worked under them, like a vet tech. That being said, it also boils down to the money part of it. So they get 80% of the funds that come off of that, then the person doing the work gets $1 a head. That doesn't, if you're gonna go through the effort, then there's a lot of nuances in that scenario.
Further questions? Go ahead, Representative Ottman.
Thank you, Mr. Chairman. Mr. Clyde, thank you for being here today, and Ms. Clark. And what I'm thinking is listening to a lot of the comments that are going on, is that this is an individual person providing a service, just like a farrier that would come to my place. If my farrier noticed a growth or a cyst or something on the hoof of my horse, they would tell me and I would contact the vet. I wouldn't expect the farrier to handle it. The other thing is during the conversations we see, especially I notice it in my house district because it's so vast, is there's a lot of area. And Mr. Chairman, the thing is that we have listened and listened to how long it takes. I mean, veterinarians have a lot of schooling, and I know humans that value their opinion on some things as well. But with the instance of veterinarians becoming small animal veterinarians, the money's better and the opportunity is there. There is that danger or that situation where we may not have as many vets anyway. So when we look at Wyoming and we look at people coming and going and we look at doctors and nurses and all of those things, the instance, people need to have, the veterinarians need to do their procedures, and they are very, very valuable for that. But what this is this is an opportunity to help our ranchers, if I'm right, during that window, because not all ranchers have a feedlot at their home. Some of them have vast areas of territory where they travel and need someone, depending on the weather, depending on how many is in the herd, depending on the feed, depending on where they are, to get a vet there. So that's this. This business that we're talking about is very expensive to get into, just like a lot of small businesses. So it's not something that someone would take lightly. It's an opportunity to help our agricultural community and also to assist vets. We hear that they are so overworked. If there was 4 hours to travel to a herd, whereas there could be a person that could handle that and take care of that, I just don't understand why it would be a threat. I think that all these things should and could very easily work in conjunction with one another, and should be. I mean, it's like if I want to open an ice cream stand and there's a restaurant in town, are they going to stop me? No, I'll do that. You know, could it take away their ice cream business? Well, it could, you know, especially if it was really good ice cream. But the thing is that I believe that what this is that this is to look at the state of Wyoming, to look at our vast territories and to see if this could be a service that would help our agricultural community to thrive, to be able to manage their herds better, to be able to, what I'm reading about is the carcass ultrasound industry is constantly looking for new technicians to scan cattle, where seed stock producers struggle to locate someone close to the ranch. This is an ongoing thing. It's across the nation. And if we have to wait 7 years for a vet to get out of this schooling to be able to handle this, that just doesn't even make sense. So anyway, thank you. That's all I had to say.
Any questions for Mr. Clyde? Thank you. Appreciate your testimony. Mr. Magagna?
Thank you, Mr. Chairman. Jim McGagnon with the Wyoming Stock Growers Association. Let me begin by saying at this point, we're not taking a position for or against this piece of legislation. We think the issue is a valid issue and should continue to be looked at. But I want to call in my brief comments attention to one item in the legislation on page 3, beginning on line 7 through line 15. One of the requirements is a sworn statement from a licensed Wyoming veterinarian that this individual has the ability to accurately and safely perform this. To me, that says that this is not taking authority away from the veterinarians, it's leaving that authority. A veterinarian has a choice. Are they willing to certify someone? There's nothing that says they have to certify them. So I think that addresses some of the concern that we're just taking control away from the veterinarians, because they would need to certify. As I visit with our members, the vast majority that I've talked with would want to have a veterinarian do their preg testing. But there are situations where they simply can't get one at the time that they need them, and they need to have an alternative. So I think that this provides a lot of protection there. It states not less than 3 occasions. We heard testimony earlier that to truly prove your efficiency, you need to do 1,000 head. Well, it might be practical here, but perhaps it would be some merit in inserting in here not more than 3 occasions of not more than 50 head or something at that point in time. So it's not one animal on 3 occasions. Something realistic in there could be helpful. The other suggestion I would make for your consideration is that when animals are being offered in the marketplace and being certified as being pregnant or open, whatever the case may be, but normally as being pregnant, that perhaps a requirement that that you would be required to state whether that determination was made by a licensed veterinarian or by one of these trained non-veterinarians, so that the purchaser would have that information and they would have the trust and confidence that they wanted on that as well. With that, Mr. Chairman, I'd be happy to take any questions.
Thank you. Any questions for Mr. Magagna and stock growers? Okay, thank you. Appreciate the testimony.
Mr. Clyde, I'm going to ask him a quick
Oh,
question.
we got a question for you, sir. Go ahead, Senator.
Thank you, Mr. Chairman. Thank you for being here. Just a quick question for you. The discussion sort of diverging from this draft bill on clarifying the statute to where maybe contract labor could be involved with pregnancy testing without having to be an employee of the producer. What are your thoughts on that way to go about this?
Go ahead, sir.
Thank you. It's a veterinarian's a contract labor. They're just a professional. It's all and to my knowledge, it's all the same thing. We hire a horseshoer, we hire a mechanic, it's all contract labor. right now, to my knowledge, what the statute reads, you can't hang your shingle out saying I'm available to do this. How you can do it is fine. Whatever road we have to go to get to that point, but it needs to be, in what I see, it needs to be legalized enough to where you can put a sign out, put an ad out, say I'm available for this, and then let the ag industry decide. Okay, this person's credible. How they pay them is up to them.
Further questions? Thank you. Go ahead.
Mr. Chairman, members of the committee, Era Arano on behalf of Rocky Mountain Farmers Union and our family farmers and ranchers. Our policy is member driven. I want to start out by saying we are full support of our vets in the state and across the region. And I want to bring us back to the budget conversation, and the conversation at the first meeting of this committee really focused on the challenge of getting more large animal veterinarians specifically, and vet services across the state. And that's really is a challenge. Our members are silent on the specific topic of preg checking. However, we have experienced this shortage of veterinary services for a long time, and our members have policy that specifically supports creating veterinary technician license under the supervision of licensed vets and other care. We ask you to revisit the conversation about licensed vet techs, and they could perform this preg checking service and much more. There's still time this interim to revisit. There's already a written bill draft, 26 LSO 0017 that we discussed last year. And this allows for both licensing through education like that provided already at Eastern Wyoming College or through experience. As mid-levels, PAs, FNPs, they've helped with medical provided shortage for humans in Wyoming. Vet techs who can do more than preg check may be able to help with this in our state. Going back to the free market, it would be up to individual veterinary practices if they wanted to expand and have mid-levels to allow providing more of those services. Thank you for your consideration of revisiting the vet tech topic.
Questions, committee? Thank you. Appreciate that. Welcome, Senator.
Well, good to be here, Mr. Chairman. Brian Boner, Senate District 2. I thought I'd swing by. You guys are in the neighborhood, and nice to see y'all. Something that this issue certainly hasn't gone away is something that was a topic on the Ag Committee about 5-6 years ago, where we also considered the vet tech avenue. Back then, the veterinarians were kind of lukewarm to the idea. It seems like they've warmed up to it now. So it looks like that's already been discussed. But, you know, and if we're having this challenge of saying, okay, how much regulation is enough is, you know, short of just getting rid of certifications of veterinarians, which I don't think anybody's thinking about. We could consider ways that technology has changed even in the past 5 to 10 years, how it's more likely, it's my understanding, veterinarians could perhaps remotely provide a diagnosis for something that, you know, if they have some sort of employee or somebody they're supervising going out and actually get the ultrasound, they would be in a position to verify that, make that ultimate decision. But that could help, you know, free up and provide some flexibility. Perhaps that could be a path forward, short of having a full-on separate license for a veterinary technician under their care. Maybe we can make it explicit that that's allowed under their general supervision to supervise an ultrasound remotely. So just something to continue to consider. If for me, I'll just do the vet tech path and allow for more flexibility within the statutes. But it looks like you guys already discussed that last year. I'm not sure if there's any point in revisiting it with practically the same committee. But in my mind, that is a level of deregulation, if you will, by giving the veterinarians more flexibility, more options to hire folks to do this work that may not require their full attention depending on who they hire. So I think if we can get to that, get to something that gives them more flexibility while recognizing there's still going to be you know, some sort of licensing or regulation in this very important area. That's what I would offer here today, and recognize it's not an easy topic. It's one that's been visited many times by this committee over the years, and hope we can continue to make progress. So, Mr. Chairman, I'll stand for questions with that.
Thank you, Senator. Go ahead, Senator McEwen.
It sounds like you're proposing telehealth for cattle. Is that kind of what you're saying?
Kind of. Well, it'd be digitally remote. They can take the ultrasound and then the veterinarian can verify it and make the ultimate diagnosis. But perhaps the veterinarian doesn't have to drive for 2 or 3 hours to, take the image.
Mr. Chairman,
Go ahead.
it's an intriguing thought. Thank you.
Further questions for Senator Boner? Thank you for being here. Further testimony in the room? I see we have a hand up online. Mr. Evertson?
We have Dr. Evertson and Dr. Osborne.
Okay, we've already taken Dr. Osborne, so we'll take Dr. Evertson.
Mr. Chairman, I know he was preg checking at the county fair, so he might not be available.
See you later.
One more chance, Dr. Evertson, if you want to join in. Okay, I don't think you'll be able to join us. All right. Going once, any more public testimony? Going twice? Okay. We'll close public comment. I think we've got some suggestions here. Committee, how do you want to move forward? I think there's a couple of ways we can do this. In the statute there, if we look at 3330-203, Romanet 5, the owner of an animal, comma, the owner's employees, I think we can simply add in the owner's employees, including contract employees, into there if we want to go that route. There was also the suggestion by Mr. Treby of having that course through the University of Wyoming. I looked up the course, that course that would allow some certification aspect into it as well. So committee, where do we want to go with this one? Representative Davis?
Thank you, Mr. Chairman. I think we need to go back and revisit this vet tech. That seems to be something that is relatively easy, meets the classification and education and everything that would give the tool for the veterinarians to meet these outreaches. I think you could expand it like you were talking about with the university and some of the things like that. But I believe in Wyoming, it currently allows for, how's that read here? The holders of a valid temporary permit issued by the Board of Veterinarian Medicine may allow this to occur. So I think if we can get some input from the board there, I think would be some help and clarification here, at least it would be for me.
Further suggestions where we want to go with this one? Representative Ottman?
Mr. Chairman, thank you. I would go along with what you were talking about with the, include the contract employee as well, to make it simple that it is just for this specific thing we are speaking, and that's the issue. When we dealt with vet techs in past things, there was hours and hours and hours of concern by the vets and a lot of pushback. With this, as we were talking about animal herd management and just a service, that a person would be certified. The producers can certainly check that. And the amount of expense for a person to go into this business and also to make sure that all the equipment is there at the producers, whether it be from this provider or not, along with the sonogram equipment. And then to say the sonogram is not limited to just, I mean, it can tell if there's two embryos in there, it can tell if there's a cyst, it can tell a lot of other things that would just enable the producer to contact their vet with better information if need be. So I really like that. I think it's simple, and I think it's something that we can do as a committee and bring it before the floor and get this thing going, because we're going into those seasons that are very high capacity and important.
Do I hear that as an official motion
Yes.
or, oh,
Yes.
okay.
I would like.
Seconded by Senator Ide. Anna, are you on the same page? Okay. Discussion on the motion, Senator Ide.
Yeah, thank you, Mr. Chairman. I like the comments of Representative Ottman and you, Chairman. I think we work with that statute and avoid layering on process and permissions and keep it simple. I think a lot of that goes on right now. This just sort of clarifies the law. So people that are doing it feel comfortable, and the law gives them that liberty. Thank you.
Further discussion?
Mr. Chairman,
Senator Craigle?
what, could someone restate the motion, please?
Yeah, so in 3330-203 Romanet 5, it says the owner of an animal, comma, the owner's employees, and then the motion is to include, right after that line, including contract employees. And then it would say, or any livestock operator, and then it would continue. Go ahead.
So, Mr. Chairman, that motion as currently written will literally eviscerate the Veterinary Practice Act, because anybody can then practice vet medicine, the way you just phrased the motion. So, because vets are contract employees as well, and I think someone mentioned that earlier, which is true. If your vet isn't a PC or a corporation, you have to send them a 1099 if you want to deduct your vet expenses, right? So they are already contract employees. You're hiring them to do a job. So by saying by using that language, contract employee, we're saying anyone can treat your animals for anything as long as they're doing it with the owner's permission, which I don't think that's the intent here. I think I think you guys are just talking about preg checking. So I don't know, it might be easier to just put in a new subsection somewhere within that says, which won't require, if we're not doing it with certification, you could just put it anywhere within the exceptions and say this is an exception to the Practice Act. Thank you, Mr. Chairman.
Thank you. Further comments? Representative Provenza?
Thank you, Mr. Chairman. My concern is procedurally, because we had a bill draft ready for the public to review today that they knew that they were commenting on. I think it would probably be more appropriate and allow for public participation if the motion was less of like, we're going to draft this bill looking straight at statute, and more, let's consider this bill draft at the next meeting. So have the change made so that we can look at what that bill looks like, gives LSO the appropriate timeframe to kind of be like, this is the issue that maybe they ran into, and we could consider it more thoughtfully rather than a motion to sponsor this legislation right now.
It was my understanding and that was the route we were going to go. Have them kind of pull it all together and we look at it at the next meeting. Representative Davis.
Thank you, Mr. Chairman. So then what we'd be looking at would be amending existing statute. Is that correct? So that's an amendment that we would be looking for, not a bill draft. Is that correct? Well, yeah,
Yeah.
in the form of the bill draft.
Further discussion? Senator Love?
Mr. Chairman, thank you. Since I started maybe this conversation earlier, I can help add some clarification to it. The real thought might be what was ended on in that vet techs could really help across a lot of aspects of veterinary medicine and be an extension of veterinarians in the practice to be more successful. The contract labor versus W-2s, when we think about preg checking, so if we're just realistic about the thought process here, you're going to pay somewhere between $5 and $10 to preg check a cow, depending on what practice comes and does it, what their overhead costs are, what their insurance costs are, just all of those things together. And so it used to be $600 you could pay a W-2 employee to do something. And today under new tax law, it's $2,000. Well, at $2,000 at $5 a head, you're actually looking at a 400 head herd you can go preg check as a W-2 employee without having to report. And so, and maybe I'm getting way too far into the business side of this, but maybe we just don't need to do anything yet and look at creating opportunities inside veterinary medicine that allows for more than just preg checking. Maybe they need help to go bangs vaccinate heifers because it's a fairly simple process that can be done without a lot of invasive issues. And so I can see where veterinary medicine could use that. As a biologist myself, I spent a lot of time doing brucellosis work in Jackson on the elk refuge and working with our state vets and state labs and done a lot of necropsies and different things. And I'm not a veterinarian, but I worked with a veterinarian to accomplish all of these things. And so maybe creating that opportunity inside of veterinary medicine is the right thing to do, and allowing us to just continue to work with what we have, because you can really go preg check a pretty good sized herd right now without having to report. And so this is just me thinking out loud, Mr. Chairman. So I thought I'd throw all that out there just as what the reality of what we have today is versus what we're talking about doing.
Thank you, Senator. I think one of the biggest concerning things is the point that Senator Craigle brought up is the way that it's put into the statute now would allow anybody to come in and bangs vaccinate and things like that. And I don't think that's our intention. So, and I don't have the answer of where we go with that. That's how I'm reading the statute now. Go ahead.
Thank you, Mr. Chairman, and everybody for all that great conversation. But I want to, because sometimes it's so easy to get sidewinded. The whole gist of this was to look at preg checking. And so the certification and this person is only right now to do that. If you recall, and I don't know that Senator Love was here, maybe a couple years ago, I believe when we were looking at extending vet techs, there was such a concern by the veterinary community because of a lot of the arguments that they had today. And so, it's business and and those things. And if we want to expand that, and if it would be to go to school and have different layers like with CNAs or whatever, that's a conversation that certainly we can have amongst ourselves. But that would be, and what I like about this is that we, through the Farm Bureau and through some testimony, we are hearing not only from the lobbyists, but we are hearing from the people that would utilize this service. And so I would like to go back to, if it is 333203, I don't have it right here, but when we include, or the owners of the animals, what language, and I'll look to them, would it be for bovine pregnancy determinations by non-veterinarians, or a certified sonogram person, or whatever it would be? What would that language look like? And keep it simple, like was the original intention of this total discussion. Thank you.
Senator.
Thank you, Mr. Chairman. I just wanted to go back to the vet tech discussion from last year. And actually, the vets did not have a problem with that. They were the ones that were asking us to bring the Vet Tech Act so that they could hire more people who did not have to be veterinarians, who could do stuff like we're talking about today. That was the whole point of the Vet Tech Act. There were a room full of vets asking us to bring that particular piece of legislation so that they could go hire folks with less education to do this exact stuff. So they could send people out to do things like pregnancy check under their supervision. They wouldn't have to be there, but they could send a vet tech out to do exactly what we're talking about today. That was the point of last year's bill that we weren't able to get out of committee.
Mr. Chairman.
Yeah, thank you, Mr. Chairman. Just to play off of Senator Crago, it wasn't unanimous on the vets that wanted the vet techs, but we're kind of getting away from the conversation of the motion on the floor right now. And I want to ask LSO a question that can you, as Senator Crago said, make an amendment, a subsection to that statute that specifically designed for pregnancy testing?
Mr. Chairman, yes, we could just do that. We could just add a new Romanet and say, you know, make layperson preg checking an exception to the Veterinary Practice Act. Yeah, you could do that.
Thank you.
Representative Altman, you made the motion. Would you like to amend it to follow what Anna has kind of prescribed us?
Yes, thank you, Mr. Chairman. On it, there is, in my understanding, this isn't, okay, is lay person just anybody, or these people that use these machines are certified and trained on this equipment? So how would that be?
Go ahead.
Mr. Chairman, Representative Ottman, you could put in that paragraph that they have to be trained to use the ultrasound machines or something along those lines. It's totally within the committee's directive.
Yeah, I would prefer that because I think that would be more acceptable. And also than it is because these machines are sold with training, just like any other type of training. So I know some of them are more intense, but yes, I'd like to see that, please.
Then Representative Ottman, you'd have to amend your motion and make sure that's okay with your second, but I could get that down.
Mr. Chairman?
Go ahead.
Okay, could you give me an idea of what you think I'm saying?
Mr. Chairman, Representative Ottman, so what I understand is you would like a new paragraph in the exceptions to the Veterinary Practice Act that would allow lay people who have been trained in using these ultrasound machines to do preg checking on cattle.
Mr. Chairman, I believe whether or not there's a difference, it's a sonogram machine.
Ultrasound machine, sonogram machine.
Same?
I think so.
Okay, so that they
yeah.
not only have the equipment, but also trained to use.
Trained to use it.
Yes.
Yeah.
Okay.
Yeah.
Yeah.
I could put that in the paragraph.
Okay. Mr. Chairman, thank you.
Yeah, thank you. Go ahead.
Thank you, Mr. Chairman. Is this restricted to bovine or is it, does the committee want that to be broader or does it matter?
Livestock.
Livestock.
The sheep producer here says livestock.
Is, Mr. Chairman,
Go
is
ahead.
that amendment to my amendment?
No, just change the word instead of just beef or whatever.
Bovine.
Cattle, bovine. It should say livestock. That's all we're asking, just livestock. And then they're not, I mean, if someone's gonna get technical.
Mr. Chairman, from the information that I have read, it dealt with cattle.
Okay.
So if the committee at some time wants to amend that, that's fine, but for.
So your
right now,
motion is cattle.
It is cattle.
Okay. And do we want to, and I heard you specifically say the ultrasounds. I think we also don't want to restrict to that. We also want palpations, I think, to be included. Representative Davis?
Mr. Chairman, just a point of clarification here. Maybe I'm missing something. We're talking about the physical equipment here, but where's the training for the diagnosis that that they're reading it correctly? What's the training behind that? Running the equipment is one thing. I can get out there and run my swather, but the diagnostics behind that are sometimes a little different.
And I think that's where we incorporate this. I think we can incorporate the class or something at the University of Wyoming that teaches all that. We can incorporate that into this somehow in the training portion, I would guess. Go ahead, Representative Ottman.
Mr. Chairman and Representative Davis, just to go with that, in some of the literature, the companies, it's just like having a drug person come that is selling a pharmaceutical to a doctor. They come along with all the information that the professional needs. So this equipment isn't sold like at Walmart. It's sold by manufacturers that have training that goes along with it. And the people are trained to know what to look for. There is all of the anatomy and everything for the animal. All of that is included. It's not just, this is a wand and this is where you put it. It is trained into the specifics of the animal husbandry as well.
Let me just do a quick housekeeping. So there is a pending motion just for the committee's clarification. Can we just rehearse what the pending motion is currently?
Yes, Mr. Chairman. So what I have is you would add a paragraph to 333203A, which are the exceptions to the Veterinary Practice Act. And that paragraph would allow lay people trained in using ultrasound machines or who are doing rectal palpations to do pregnancy checking specifically on just cattle, not livestock in general, but that's what I've got.
Okay, is the second good with that? Okay, committee, now discussion on the pending motion. Did you have something, Representative?
Real quick question. So the language includes training?
Mr. Chairman, Representative Provenza, training in using the ultrasound machine.
And there would be no there's no definition or standard of what that means, correct? I mean, I'm looking, I have right now in a cart on a website called WellU. I can buy a portable veterinarian ultrasound device for $1,219. I don't have to do any sort of test or training on here. And so I'd be curious, do we need to define what that term is and what that means? Thank you.
Mr. Chairman, Representative Provenza, right. I could put a definition of ultrasound machine at the direction of the committee, or I mean, I might have to do it anyway, just because it might be seen as somewhat ambiguous. So that is a good point. And maybe that's something that the committee should discuss as well.
Thank you. Senator Love.
Chairman Banks, thank you. So I fear that we're about to talk ourselves back in the full circle here, back to the original bill. And so the whole point of my conversation is what we currently have as our law is actually the least restrictive of anything we're discussing. Everything else we're discussing is going to create more burden for producers to do exactly what they're doing today. And so the conversation in all of this is that maybe there is opportunity to make a lower cost or more practical veterinary tech position that will benefit the veterinary medicine. And our current law is actually very non-restrictive, if that's what you want to say. It's the lowest amount of regulation we're going to get. Everything else we're talking about is going to be more restrictive.
Further discussion? Go ahead, Representative Strzok.
Thank you, Chairman. I think that what even brought this up is we have a young lady that would like to have just a little business doing some ultrasounding. It's not going to be an all year thing anyway. She wanted to open it up. This is what started this whole thing. Have we even addressed what she's asking in this roundabout crazy thing? And she, like her father asked, she just wants to be able to open this up a little more. And thank you.
Go ahead.
So if I were a business owner and I was young and energetic and wanted to do something like this, I would run an employment ad in the paper saying I can work for you and this is what I can do.
So,
And we're free to do, she's free to do that.
She's free to do that today under the current law
For multiple people.
for multiple people.
Senator.
I kind of need some clarification wrapping my head around some of this as we go around and around and around. Is it a requirement in the state of Wyoming to have specific training and hours to use a sonogram? And if it's not, then you're absolutely right.
I think the statute that Senator Love's talking about is right there. That one we keep going back to is Romanet 5, the owner of an animal, the owner's employees. And that is pretty broad in general, I mean, of what that entails. And so, yeah, I think that's where Senator Love's coming from, is the way it's written right now. Can we just do it? Further discussion? Yeah.
Yeah, that's what we're trying to drill down to here. I mean, I'm all for less regulation, more freedom. And, you know, the motion to me sounds like this broadens it for folks in this room that don't want to go to work for the operator on a W-2, employment contract, and broadening it to a 1099 subcontract labor, pure and simple. That's what I think the way the motion was proposed, that's what it does. It makes it broader and not less restrictive, or more restrictive, I'm sorry. Thank you. Can anybody deny that, or thank you?
Go ahead.
Mr. Chairman, thank you. So the current motion as it reads would require training, and which was going to require a definition. And by that definition will require some sort of certification in order to get to that point to meet the legal burden. And so it's actually going to be more restrictive. It's going to require some certification to say we have this ability, whereas currently you don't have to have that. You can go buy your ultrasound machine. You can go to work for anybody. You can, and pretty well without limit, as long as you're willing to do the paperwork of being in business, which all of us have that burden at some level. And so you're working through the current employment statutes that get you to that point already. And so
Mr. Chairman, Senator Love, can we water down that language to where we don't have to have the certification or the education? I mean, is that possible? I'm reading back what the draft might be. I don't know as we need that language in there, just saying that they can be contract labor, pure and simple.
Mr. Chairman, so what I'm gathering from the discussion today is if you just add contract laborer in there, that opens it up to anybody basically anybody in Wyoming, any layperson, because vets are already contract employees. It would, by just doing that, you would open up the Practice Act quite a bit. The way that the motion stands now is it would just allow for lay people to do preg checking as long as they knew how to use an ultrasound machine. And you could even make it like, if they choose to use an ultrasound machine, they have to have training in it or something along those lines. But that's basically what the motion reads now.
Thank you, Mr. Chairman, and not to beat a dead horse, but just to say the whole reason that we did this was the young lady, Miss Clyde. She contacted me and said, this is what I'm thinking about as a side business because it's seasonal. And is it legal? And I said, well, sure. And then I looked in the statute and I spoke with Dr. Hazel. And it was like, no, unless you work for that producer, it is not. You have to work for the producer and then you can as an employee. What she wanted to do was to speak with Ms. Clyde, was to offer her services to people that said, I need this done. Can you come over here and do this? And she says, yes, I have a machine. I am trained in using it. And if you would like to hire me, I would be glad. And she doesn't work for their ranch. If she went and worked for one of our ranches, she could do it for us without this change. If she does it for her own, she can, but she can only do it for someone that employs her or her own. So that is why we're here. So however that needs to be done is absolutely fine with me. And that is the intent of this entire discussion, was how can we make this available for someone to do this service without breaking the law. That was the whole intent. So whatever it needs to say, I'll amend it, change it, or whatever.
Just a quick clarification. I don't think she's breaking the law if she goes there and does a 1099 because she's now an employee of that place. So that's kind of a way around it.
Okay.
My belief anyway.
Go ahead.
Yeah, I'm glad we're hammering this home here because the lawyers there, what Senator McEwen just said, could they do that legally the way the statute reads?
Mr. Chairman, that's honestly it's kind of a gray area. I'm not entirely sure. I think that would be a question for the Board of Veterinary Medicine, honestly.
And I think that's the problem we're seeing is the way we read it. We think that's perfectly fair. If the board is going to come down hard on that lady and they interpret it differently, then we need to fix it. I'm okay if they're going to let her do it. If they're not, we're going to fix it. That's where I'm sitting. Go ahead.
So as a normal course of business, if we have an employment contract and I, as the employee, say, Ranch XYZ, I'm going to be employed by you today, sign this document. They agree to the employment for that day. It's day work. It's as an employee. Like this is, we're making this way more complicated than it needs to be. And so you can easily do this with minimal documentation and it's completely legal under our system today.
I just fear the board is not on the same page with you. Go ahead.
Mr. Chairman, and so I don't know if it's as simple as the good senator says. So that day, an employee in Wyoming, are you going to be paying work comp? Are you paying all the other things that go along with being an employee, or is that person an independent contractor? Because we talk about contract employees, and most of us, that means independent contractor. That does not mean employee. And so I think we got to be careful about that and not, I don't want to mislead the public, I guess. And I don't want us to leave here with people thinking, well, the legislature ag committee says this when we might be wrong. And so I think we got to be super careful about, because I actually don't think that. I think if you're a contract employee, you're not going to qualify as an employee under the statutes and under this statute in particular. Because otherwise the word employee means nothing. I mean, that just means anyone could come in, to your point, and sign a one-day contract and do whatever. Doesn't have to be a vet if we look at it like that. And so I don't read it the same way. I think it's much more restrictive than a contract employee. I think it's an employee, someone who we're issuing a W-2 to at the end of the year under our direction as a rancher that actually works for us. Because a contract employee comes in, they might be under your direction if we're talking day labor, for example. But most people aren't listing them on their work comp policy. They're just there for the day, independent contractor. That's how you get around all of that other stuff. So yeah, I don't, as a lawyer, I don't read it that way. And just dealing with employment law a little bit.
Just as a follow-up on that. So just to clarify what I was saying is that so I say sign a contract, and I would do it as an employee, W-2, specify that. If the amount does not exceed the tax burden of $2,000, none of those other things have to happen. If it does, then the ranch would still have to file the taxes, put the paperwork through, do the IRS side of it. But it's still legal if you do it that way and you meet all of the W-2 burden. It's going to take a pretty big herd of cows, though, for you to get over $2,000 at $5 a head.
Mr. Chairman, sorry to get into the specifics, but you wouldn't be doing that. You wouldn't be worried about the $2,000 anyways if you're doing a W-2. The $2,000 limit would only apply to a 1099 and contract employee, not to a W-2 employee. Those would be two separate positive. Those would be two separate things, because the W-2, you're going to be withholding your taxes. You're going to be paying your portion of FICA, all of that goes along with being an employer of a W-2 employee. 1099, you're not doing any of that. And so there wouldn't be any reporting other than your monthly reporting to the IRS on all of your payroll reports.
Further discussion, Senator Ide.
Good discussion. I would, bringer of the motion, I would propose an amendment to it to take the training out. I mean, why, if you're an employee, you don't have to prove that. If you're a layperson, I think that's incumbent there again on the producer, the operator. I don't know why we need that language in there. And that would clean it up and make it more, make it broader to solve the problem that we're trying to do here today. Thank you.
Further discussion? Senator Grego.
Just along Senator Love's comments, you still could be an employee of any ranch or operation for a day. There's no law against that. You could literally be an employee for a day. It just requires different paperwork. So you wouldn't necessarily have a quote unquote business or an LLC set up to go do preg checking, but you could be an employee. Statute says that. You could go be an employee of multiple ranches, work for each of them for one day. That would be allowable under the law as long as the ranch is doing all the proper paperwork. That is true. I mean, I totally agree with that, the way the statute's written. Now, a lot of ranchers aren't going to want to do that. The paperwork that goes along with that is going to be a pain. You're not just going to write one check and be done for the day. There's other stuff that goes along with that. If you have a work comp policy, then that person has to be listed on that. You're going to be, I mean, all of the things that go into having employees in Wyoming would fall under that, but it's doable and it's legal the way the statute's written. It's just, I'm not sure it's legal as an independent contractor or independent contract employee.
Further discussion? Representative Johnson?
I hope this is better. This is Elon Musk's Starlink. So is that better?
Yeah,
now?
sounds good.
Well, I'm just saying that we should allow this young lady to work as she wants to, whenever she wants to, and just show up and I think we're going down a rabbit hole on taxes and W-9s and all that. Just allow this young lady to work, and it's up to her. Anybody that wants to do preg testing should be allowed to. No regulation, no certification. It's a free market system is what I would say. And I would make it intent on the Board of Veterinary, the veterinary board, that this is our intent, to allow this free market to work this way. And I don't know that that's the way that amendment is, but that's what I would like to see.
Further discussion? We do still have a pending motion on the table. Go ahead, Anna.
Mr. Chairman, can I just clarify the motion, please, just so I'm on the same page? So basically, it's still that you'd add a paragraph that would allow lay people trained in using ultrasound machines or who are doing rectal palpations to do pregnancy checking on cattle. Is that what I understand?
Yeah, thank you, Mr. Chairman. Representative Ottman, I was talking about amending that to take the training part out of that. Is that something that you're willing to accept on that motion?
Mr. Chairman, yes.
I'll second that. So if you could amend that and verbalize that motion on the floor.
Yes, Mr. Chairman. So you would be adding a paragraph to 3330-203A that would allow lay people to do pregnancy checking on cattle. Or
yes.
Yeah.
Did you have something? Go ahead.
Thank you, Chairman. Could we add, if we don't want to do livestock, could we add sheep and cattle for the people that would like to do this on sheep also?
Do we have a second on that? Second. Seconded by Senator Craigo. Discussion on the proposed amendment, including sheep. Go ahead, Senator Pearson.
Thank you, Mr. Chairman. I just don't understand what is the big deal with going through a course of some sort and being certified in something that you are passionate about doing.
So actually, we're still on the amendment that is including sheep.
Well, I'm good on including sheep.
Okay. Further discussion on that amendment? All in favor, say aye.
Aye.
Opposed, no. Okay, sheep is included. Go ahead.
Thank you, Mr. Chairman. So I know in our own practice, when we had cattle, I mean, I went to an AI school. Obviously, there are courses through a couple of our colleges in the state. I don't understand why this committee is hesitant on somebody going to really learn what they're passionate about doing and getting some training and knowing what they're looking for. I mean, I've done it for AI and cattle. I've ultrasounded a lot of sheep. And actually that was under Dr. Logan. I mean, basically with my dad and another producer, getting training on that. And so I don't understand what the hesitancy is. I mean, we're not asking this person or these people to go to veterinary school. We're not asking any of that. I think my AI school was 5 days or something like that. So what is the hesitancy in that, especially considering that, like Representative Provenza said, you can get online and buy an ultrasound machine. I don't understand what the hesitancy is in this committee on somebody who is going to be doing this across the state, possibly taking income away from our veterinarians, things like that, having some sort of training, some sort of a certification that is not that intense, that demonstrates that they know what they're doing. Thank you, Mr. Chairman.
I think, Senator, that you could offer that amendment and see where the committee stands on it altogether and offer an amendment to that to include some training such as the University of Wyoming reproduction class, if you would like. Go ahead.
Thank you, Mr. Chairman. We just took that out.
We didn't vote on it.
We didn't vote on that amendment? Okay. Just sheep, okay?
Yep, just sheep.
Thank you.
Mr. Chairman,
Go ahead.
as I previously stated, one of our jobs as legislators, Mr. Chairman and committee, is to look at the needs in our communities, to look at some things that our constituents would like to do as far as starting businesses, as keeping our young people in our communities, as far as free enterprise, as far as herd management, as far as safe herds, as far as food freedom. And to see that some people think this is a joke really is very offensive. If you're going to amend something today to try to get it to fail, I ask you to quit. There is one specific thing that we've been trying to do, and that is to open this up, to make it available and an opportunity for a business, for people to be able to, ranchers, to be able to hire someone. If I had a herd of cows or sheep or whatever, parrots, and I was going to ask someone to do something with them, I would speak with them and make sure that I thought in my mind that they were qualified. I would want to know what they were using and how they were doing it. It's just like going to a chiropractor or a farrier. It is up to you to say, do I trust this person with myself or my property? That was the intent of this legislation, and I hope that it continues to be so that we can finalize it to the comfort of the state vet, but also to our ranching communities. Thank you.
Further discussion, committee? I think Senator Pearson's point's well taken. And I think that we should include somehow in there through training in a class. I mean, the class was offered to the University of Wyoming. I think if they're able to show they took a reproductive class or something, I think that would be a good addition to the bill. I think the bill would have a better chance to pass. And so that would be an amendment I would offer at this time. If we get a second.
The training's already in there, right? I thought the training was.
Go ahead.
Mr. Chairman, I heard your motion.
Okay.
We had just taken, we'd previously taken the training out. Now you want it back in and now we just have to vote on it. So.
Go ahead, Representative Altman.
May I, because there is more information in this, could I call somebody up that can that can address these questions? Ms. Clyde Hadassah, would you please come? Okay, and not to put you on the spot, even though I am, but would you, briefly, but just explain what it is about getting one of these machines and what happens and what kind of training there is? Would you please cover that and pull the mic to yourself so you don't turn the green light on? Thank you, and thank you, Mr. Chairman. Your name?
Hadassah Clyde. The company that I was looking to get my machine through offers training classes that you can take when you buy the machine. And also, if I were to do this, I would get training for it. So whether that be through the community college doing it, there are other companies that offer it around the states. RepoScan is one of them. They come and teach classes and stuff, and they'll have some training classes here in October, I believe. And just, there are trainings that you can take to do it. And all of the ultrasound machines that I've looked at, they do offer training.
And follow up? Okay, and what are some examples of things that you would be trained on or in? What is it?
How to use the machine, the reproductive system of the animal, so cattle, all of the machine stuff. So how to use all of the equipment, how to take care of the equipment, everything that's involved with that.
Follow up.
No.
Can I say something?
Go ahead.
I did have an email from Kylie Dorr addressing the like what is allowed right now. And she says, as the laws are now, it is not allowed for what I want to do. So I did contact her prior to talking to Representative Ottman. So
thank you. Questions while we have this young lady? Representative Davis.
Would you share why this is not allowed? Why you wouldn't be allowed? Maybe that would enlighten us on what we're trying to look at here.
Because the board said so.
Why?
That's the question we're trying to address.
yeah, so she said that it would likely fall outside the scope of exception and may require appropriate license. So.
Thank you for being here. So you mentioned that you would get this training either maybe through the community college, and then there would be training with the equipment that you're trying to purchase. Do you see any issue with requiring that training for someone that is going to do this?
Thank you. No, not at all. I think training is good. But yeah, the producer should be able to decide and determine if that person is qualified to preg test their cows.
Further questions? Thank you. Appreciate you being here and sharing that with us. Okay. Back on discussion committee. Where are we at?
Mr. Chairman, did you make a motion on training? Did it receive second?
I thought, did you have it received? Okay, yep.
You said to vote on it.
I have to vote on it. Okay.
Mhm.
So that's where we're at, is the motion to include training with this. There's no discussion at this time. Oh, go ahead.
Would that training be of the equipment or of the person?
Oh, pardon me.
Is, Mr. Chairman,
Go ahead.
is the training that we're talking about, is it the training of how to make sure they know how to use the equipment?
I would say probably yes, to use the equipment and the process.
Mr. Chairman, specifically to know how to use the equipment? Okay, that's acceptable. Sure.
Go ahead.
Thank you, Mr. Chairman. The testimony that we heard from the young woman is that she's also talking about going to the local community college for a training on the reproductive system to know what she's doing. I don't think that's an unreasonable ask. I think we're at a crossroad and a conflict between what we view the role of government to be in this instance. I think that some folks on this committee want to make sure that anybody can do this and it should be complete free market. I think I'm in a different camp where I also want to protect our ag producers and our ranchers who are struggling with this, just the state of the world really. And some folks are really looking for how can we reduce the cost, but I don't want them to be taken advantage of. And it's not always easy to discern who's going to do that. And so I think the appropriate thing, as Senator Pearson said, is to ensure some level of credibility check, because you don't want Carly Provenza showing up on a wagon saying that I can provide a preg check. And maybe I'm really good at selling that I can give a preg check and I can't. So how do we protect our ranchers while also honoring the ideology of this committee that wants to make this easier for some folks? If that's the route we want to take, I think we should tread lightly. And it shouldn't be going from one end to the other extreme spectrum. So that's my 10 cents, Mr. Chairman. Thank you for the opportunity.
Thank you. Further discussion on the amendment? Go ahead, Senator Iden.
Yeah, I'll be real quick. I probably disagree with a lot of what Representative Provenza was mentioning there. I think as the lady's testimony earlier, it's the role of the operator, the producer, to decide whether that person's qualified or not. And I think the more liberty you have to do what you want to do, to go to work without layers and layers of bureaucracy, is the best path to go on this. So thank you.
Further discussion on the amendment? Senator Pearson.
Thank you, Mr. Chairman. I can understand that, what Senator Ide said. But at the same time, if you're passionate about doing something, you're willing to do a little bit extra to learn these things. And, I mean, it's just so valuable for people to go and learn about this, not just put an ultrasound in and be able to see cotyledons or things like that. When you go to AI school, they actually have cervixes that are out on a table where you can look and see exactly what you're feeling in that animal. And so the value added for somebody that is doing this to go and learn about the anatomy, learn what you're looking for, all of that. I mean, you may think that that's restrictive, but it's really not. It's really helping whoever is going to be doing this to learn, exactly what they're looking at, not just sticking a device in and looking for cotyledons, but actually being able to see what is going on in there. And so I don't feel like that this is restrictive at all. you know? I mean, I've done all of these things. I used to preg check all of our cattle, you know, but I got training on that and it's not restrictive. Granted, I didn't go out and try to preg check a bunch of other people's cattle, but it's just value added. It's just value added, you know, that could help someone that's doing this to say, you know, I went here and did this training. Granted, on ultrasounding cattle, it was only a 2-day, you know, we got our machine, a 2-day kind of class, I guess, at a dairy in Colorado. You know, where we went through all of these cows and I was showed what I'm looking for, what I'm doing with a veterinarian, of course, but you don't need that. I mean, obviously, there's been testimony that when you buy these machines, there's training. There's training through the colleges, things like that. It's value added. It's not trying to hinder these people from being able to start their own business. And so I would ask that we keep the training in there because it's value added. It's not only value added for the person that is doing it, it's value added for the producer that could probably be using these people. So thank you, Mr. Chairman.
Thank you. We ready to vote on the amendment? Okay, all in favor of the proposed amendment to include training, please say aye. Opposed, no.
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 Show of hands, all in favor? I see 7. All opposed? I see 6. Oh, 7. Okay, 7 fails on a tie vote. We're back on the bill. Any further discussion on the bill? Or excuse me, yep, the bill, the proposal to create a bill draft. Question been called. All in favor, please say aye.
Aye.
Opposed, no. We'll go by hands again.
As we start around, I think they in chat, vote on the bill draft.
Yeah, the proposal to create the bill draft. Go ahead, Senator.
I thought we were bringing this back to the next committee meeting before we're voting on the bill.
Right. The draft to take to the next meeting.
Okay.
Yep.
Just the draft.
Yep. Yep.
I'm not the sharpest tool in the shed.
So all in favor of a draft moving forward to the next committee meetings, we can look at this again. In favor, please say aye.
Aye.
Opposed, no. I would say it passes for the next meeting. Okay, we'll look at this again. That was a heavy lift committee. Thanks for the good discussion. We had some really valuable inputs. Appreciate the work and the thoughts. Mr. True, hopefully yours is not such a heavy lift. We'll invite you up at this time.
Mr. Chairman, committee, Steve True, Director, Wyoming Livestock Board. I take it I'm here to testify or give an update on EID tags. I'm not sure how you want me to proceed. If you want me to give you a little timeline or you want me to just answer questions from the committee.
Committee, I think it would be valuable to, what's that? Just questions? Okay. Everybody good with the questions for the director? Okay, go ahead, Senator.
Where are we at on the RFID tags? I mean, just as a general overall viewpoint, are they required? Are they not required? Are they required if you're going to take animals over state lines? Metal tags will work if you still have them in the state. You understand what I'm asking?
Mr. Chairman, Senator McCune, that's kind of a loaded, long answer question. Yes, EID, the federal EID tag rule is still in effect. in any other state that we would export into is going to require those on those classes of cattle that were listed in that federal rule. Breeding cattle, sexually intact cattle, 18 months of age of older, exhibition cattle, all dairy cattle. Did I miss one? That's most of them. So yeah, that's still required. And that EID rule has not gone away. Became final on November 4th of 2024. So we're coming on 2 years into it. I don't think it's going anywhere, would be my prognostication. However, based on resolutions from my board, legislation that you guys passed that mirrored the resolutions of my board a few years ago, Dr. Hazel and I were directed to go converse with metal tag companies, see if there were any options about things we could do. There are no options, or there were no options offered to us as far as interstate movement for metal tags at that time. All of the previously allowed metal tags, the Silver Bright noose tags and the old orange brucellosis vaccination tags were grandfathered in if applied prior to that November 5th start date, but they were no longer available after. So those tags were not available. So in order to speed this up a little, I'm going to jump around a little bit off of that. We were directed in those resolutions along with that to have those conversations. We talked to the tag companies about a lot of things. They were not able to produce any USDA approved tags, metal tags, after that November 5th date. So we went through our rules, our standard rules at that time, Dr. Hazel and I, and we spent basically 2 years trying to figure out how to get a Wyoming only, within the borders of Wyoming, tag legal that met the parameters of a bill in 2021 you passed that said producers could use anything available under the 2013 ADT rule. However, that statute also says for animal disease traceability purposes. That means that we had to figure out something that could be a regulatory tag that we could at least trace within the state of Wyoming. So what, and Dr. Hazel is free to jump in here and correct me at any point in this, because we've rattled this so long, I've probably blocked part of it out. So what we've done, or what we were able to accomplish, Dr. Hazel working through the veterinary services part of USDA through their transition when there was nobody to talk to, trying to find out if they would accept an in-state bangs tag of some kind for Wyoming that would be good only with, you know what, and I forgot to give your folks a drive, so I'll describe it. An in-state tag. So we're able to approve a yellow metal OCV, calf hood vaccinate tag, for use within the state of Wyoming, became available on June 1 of 26, doesn't cross a state line. In an animal that was requiring an EID tag, that metal tag doesn't do anything crossing the state line. No other state will accept that. The USDA did, however, agree with us and in writing to accept that as a brucellosis calf hood vaccinate tag for the state of Wyoming. Along about that same time of June 1, when we got that approved through USDA, the USDA determined through some other needs of some other states that there were still some old orange bangs tags available. Some vets had those in storage, and they said those could be used for an OCV tag within the state of Wyoming, calf hood vaccinate again, within the state of Wyoming, in the same purpose. So that gave our producers 2 avenues. This yellow bang, three avenues. The yellow bangs tag, Wyoming tag, it's a Wyoming specific tag. Any orange tag that your vet may have had in his garage, he could put those in until he runs out. They weren't going to make any more available, but they would allow those to be used until that source ran dry. Or you can use an EID tag. So there's actually 3 purposes or 3 options available to calf hood vaccinate within the state of Wyoming. That's where we got with the tag process. None of that changes what the EID rule demands from the USDA purposes or other states' import rules. And there's not a single state out there that will accept our yellow tag as interstate movement. So that's kind of the long and the short of it. I would make a quick comment also in that process. There's a couple other exemptions in that rule about things that could be accepted in lieu of or accepted as official ID. We did make that one agreement with Utah to use brands in a very narrow fashion back in March of 25. So we could move some cattle between Utah and us and use brands as an official identifier. Again, a very narrow kind of an agreement. We went to every state based on your ask and our resolutions ask, or board's ask, every other state that brand inspects, and nobody else wanted in on that. And so that didn't fly. And that was the only other one. We've had a lot of people talk to us about tattoos. The tattoos listed, you have brucellosis tattoo. Whenever they vaccinate your calf, you get a tattoo. That's not the one in the USDA rule. They're talking about breed registration tattoos. Those could be used if agreed to on shipping and receiving states. We had no request to try to do that. The other thing I want to give Dr. Hazel and her staff great kudos for is in statute, you told us to broadcast as far and hard as we could what your options were to our producers. Through multiple media bursts, I don't know how many Gov Delivery on the state vets Gov Delivery sites, how many updates they gave of what these tags were, how they could be used, when you can get them. And every public meeting that either one of us was at, even if there was only one of you on the other side of the table, you heard this story from us for quite a while. So I just want you to know that she and her staff did a tremendous job of trying to get all that information out there. So that's kind of the nexus of where we're at. I do want to nip one story in the bud that I've heard quite a bit, that President Trump was writing some executive orders that would repeal the EID rule. Didn't happen. So you all can let that go if you're thinking that happened, because it didn't, and it's probably not gonna with the screwworm problem we've got going on, and there were other beef marketing deals tied to that. So with that, Mr. Chairman, I would defer to Dr. Hazel if she has anything she wants to add, or any comments, or take any questions from the committee.
Okay, you're good, Dr. Hazel? Okay. Further questions, committee? Senator Ide?
Thank you, Mr. Chairman. Thank you, Mr. True, for that testimony. That was good. Are you referring to this 2021 legislation 229, Chip Nyman? I was just looking at it here. So is that sort of the controlling statute that came out of that bill that dictates kind of in state, you can use whatever, the way it reads in the statute without boring everybody? And then my second question is, that agreement with Utah, was that through the MOU stuff that we approached, a couple of years ago in the Ag Committee? Thank you.
Mr. Chairman, Co-Chairman Ide, yes. I'll touch the MOU first. Yes, that's the Utah. We've talked about the Utah. We kept you updated on that when we were in those conversations with them. It still presides. We still have that agreement with them. And yes, that is the statute in the bill. That your bills in the later sessions that mirrored the resolutions we were already involved in the actions that you asked for in that based on our board resolutions. So that was a little redundancy, but it's in statute. But yeah, where we made this got with this yellow tag is through the amendments to that 1118-117, our confidentiality statutes in 2021. That's where we came up with the yellow tag, and then the orange tag followed suit when the USDA released that. So I hope that answers your question.
Senator Pearson?
Thank you, Mr. Chairman. So my question would be, how do we get a hold of the yellow tags? And then, so before they leave the state, they would have to have an EID put in. Would that be through the cell barns within the state, or would the producer need to have the vet come out and put an EID tag in for anything that's going to the cell barn?
Director.
Mr. Chairman, I'm probably going to let Dr. Hazel bail me out on part of that because there's different requirements depending on where your cattle are from. And I'll let her visit too on the, how you acquire that yellow tag is, she was the major part of that conversation with the tag company.
Go ahead, Doctor.
Chairman Banks, Senator Pearson. Once again, if I forget part of your question, just holler at me. Okay. So first of all, the yellow tags are available through veterinarians. Veterinarians order those tags directly from the company that distributes those tags. Whenever a veterinarian does order those tags, we receive immediate notification of the tags that they've ordered, the amount, and the numbers of those tags. Those tags can only be applied by a veterinarian or a veterinary technician that's working with them when they're doing brucellosis vaccination. Animals that fit the EID rule, so animals that are over 18 months of age, sexually intact, dairy cattle, exhibition cattle, rodeo cattle, recreational cattle, etc. Whenever they cross state lines or do any regulatory testing whatsoever, they have to have an EID tag. So for example, if you have a 12-month-old female in the DSA that's undergoing regulatory testing, she has to have an EID tag. EID tags may be placed by the owner, the manager, the veterinarian, the sale barn, anybody. EID tags are available to anybody from any distributor or any veterinarian. But those EID tags have to be placed whenever they enter commerce or they undergo regulatory testing. So if you are taking, for example, some cattle to the market that are of age to meet the federal requirement rule for movement, say they're 2-year-old females, the EID tags will be placed at the livestock market by the veterinarian that has to write the health certificate for those animals to travel. So those EID tags, to answer your question, could be placed by the veterinarian. They could be placed by the owner. They can be placed by pretty much anybody. Whenever a veterinarian places EID tags, they're going to record the numbers that they placed into your cattle. And then those numbers are available to us through record keeping from the veterinarian. If the producer buys those tags from a distributor, then the distributor has the information as to who they sold those cattle tag numbers to. So that data is available to us should we ever need it for traceability purposes down the road. Did I get all your question?
Thank you, Mr. Chairman. So what about cattle that go to, I'm just wondering, does the EID tag need to be placed at the point of origin, or if some cattle within the age limit go to, say, Riverton Livestock Auction, would the veterinarian there place an EID tag before it goes across state lines?
Certainly. Chairman Banks, Senator Pearson. So if you had heifers, like it could be yearling heifers, that you wanted to sell, they would have to have an EID tag if they're leaving the DSA, or if they're going to a market, they would only have to have an EID tag if they're yearling heifers, for example, if they fall into the interstate requirements for movement for that state of destination. So an animal under 18 months of age that's in feeding purposes only may not have to have an EID tag if it's staying in that feed chain, but if it's going for breeding, it would. But that tag, once again, if it's at the livestock market, say you take them to the market, a load of heifers to the market, they're yearlings. If they are leaving that market and the state of destination requires them to have EID tags, then the market veterinarian would place those tags, because the market veterinarian cannot write a certificate of veterinary inspection unless those animals have EID tags. If the producer used yellow metal tags for Bangs vaccination, or if the producer requested those and the veterinarian applied the yellow metal tags or orange metal tags in this case, the producer still has the option of putting in EID tags before they go to the market on their own. They can have their veterinarian come to their location and put in EID tags before they go to the market. Or they can wait, and at the market, the veterinarian at the market will apply EID tags if the heifers need them for their next destination. Okay, you're welcome.
Further questions, committee? Okay, thank you. Appreciate that
Chairman, sorry to
update.
take so much of your time, but
Keep it short next time. Thank you, appreciate it. Okay, committee, that fulfills our morning responsibilities. I think we'll break from lunch and we'll come back and resume orphan water rights at 1:30.